Hey everybody, thanks for joining us. We do classes in a lot of different ways sometimes. Well, maybe not a lot, but this class is basically like a deeper dive into the digestive system. And the idea that I tried to lay out here is both a symptom approach and also a functional approach. I didn't tie in energy or mystical aspects. I just made it very kind of straightforward. But what I tried to do was, if you had digestive issues, not to just go to the digestive issue, but to give you information where you could read about it and see symptoms and things that might be contributing to the factors and um, uh, I don't know, just made it so you didn't have to try to run things down yourself. I tried to lay out as much information as possible. And so I don't know, I think there's probably about 85 pages here. And it's not like laid out where we're going to be firing off like different protocols in a system like we would do normally in a class, but this is more of like a reference guide just for the digestive tract. And so at first, the first segment is just talking about what is the digestive tract. If you have a little bit of an anatomy physiology background, it's just kind of a layout of just the different parts of the digestive system. And then the second part, we looked at functional things that will make the digestive system function better, excuse me. And we did that in the respiratory, digestive, and urinary tract class, like healing the respiratory, digestive, and urinary systems. This is a little bit of a deeper dive. There's more applications in that area. And that's where we're going to kind of linger. But then after that is like kind of symptoms and conditions. And, there's a deep dive on things, because sometimes you might be dealing with a liver issue, but what kind of liver issue? And, what things should you be doing to the liver? And, you know, colitis, what's colitis? It gives you an explanation, it gives you symptoms, it's kind of a deeper dive. And so, you know, uh, hopefully it's a reference as we go through this. If there's conditions that are not in there that you have, an issue with or, interest in or something like that, let me know what it is so I can go through and do a write-up. This was a lot of tedious work. Like, I'm sure that, I probably have left a couple of things out just because it's been 30 years of notes all pulled together, and I did my best, but Letty usually pulls together the booklet in a day towards the end of the week, and she's been working on this one all week. It's been quite the project, and so, like I said, there's a lot of tedious work, but hopefully, it's like kind of a turnkey way for you to just open up the booklet and go, okay, I have dysentery, or not that that's very common here, but still. Um, it hopefully is a little bit of a deeper dive for you so that you can kind of look at it in an educated way and go, oh, this is what's going on. These are contributing factors. These are the things to do or not do. And then also the oils and the application of the oils. Sometimes I'll just say the oil, but, do we inhale it? Do we take it internal? That kind of stuff. And so this weekend is going to be a lot more of, we'll do some things, but it's also open to you guys uh, asking questions about different things, and we can kind of have it be a little less formal. So, um, with that, you can kind of see right off the bat Section A, it has like the anatomy and it kind of goes through and breaks down the pieces. And then it also talks about the different parts of the nervous system that heavily impact this. It talks about vagal tone and it talks about the gut-brain axis. Um, but let's drop down to section B, where we're dealing with functional issues of the digestive tract. So this can be a lot of different things. We kind of covered this a little bit in the healing the respiratory, digestive, and urinary tract, but I'd like to go through and revisit this. And, sometimes you hear the term leaky gut thrown around, or just the permeability of the lining of the gut or the intestine. Here we're going to do a little bit of rehab on this. And you can see we'd be using Palmarosa. Mm, Also, a thing that works really well for this is Bacopa, the tincture of Bacopa. And, Bacopa is traditionally thought of as being a thing for your brain, which it does work for that. But, the thing with the gut is a lot of our brain health is tied to gut health. And a lot of our immunity is also tied to gut health. And so really focusing on the gut impacts both our brain, our thinking, fuzzy, diminishes fuzzy thinking, but also it improves our immunity. And here we're looking at, the effects of inflammation, and especially inflammation in the gut, a stress-plagued digestive tract. Sometimes it might be the foods that we're eating. It could be that other things are going on in the body where there's a lot of inflammation or a lot of stress. A good example would be maybe we have a bad hip or a bad knee that's bone on bone, and there's a lot of inflammatory material just kind of circulating through the body. And a lot of that's going to land in the gut. And so we want to look at reducing the effect of whatever stresses or inflammation have had on the intestinal lining. And so we would use Palmarosa. We could do a breathing pattern, but also taking a few drops of Palmarosa internally for a while. You take 2 or 3 drops in water daily, but also the use of Bacopa. And Bacopa, I, I suspect that part of why Bacopa works so well for the brain is partially due to how well it works for the gut, especially the lining of um, the digestive tract. And so, whenever we have a lot of inflammation in the body, the the wall of the intestines and things kind of like separate it. They don't really separate it, like stretches out a little bit. Inflammation reduces tone in a particular area of the body. Like, so if you have a lot of inflammation in your shoulder, you lose muscle tone in that particular area. And the muscles don't quite function like they should. You lose strength. Sometimes you lose range of motion. Um, you lose the ability to bounce back from effort, right? And so the same thing can happen in the gut. And so what happens is it's like the tissue kind of stretches apart or it loses tone, and then it makes it easy for things to pass through the lining of the gut. And so we might have this issue and might not even know it. And so Pomarosa is very healing to this particular component. And the tincture of Bacopa, when taken daily, can be very, very healing to the lining of the gut. And so, like I use Bacopa sometimes for the lining of the gut, just like maintenance. I don't think I have an issue there, but I always notice that when I take it a few days in a row, my stomach does feel a little better. So maybe I do have a little bit of an issue there. But I use it primarily for strengthening the brain and cognition. And so I would say treating this is not just treating the gut, you're also treating the brain and the mind. And so with that, um, let's have you pull out Palmarosa. If you don't have Palmarosa, I mean, Palmarosa is the primary choice, but for the sake of this process, let's have you use maybe like geranium. And if you don't have that, um, one of the other digestive oils like tarragon, rosemary, anise, or ANS support. We're going to be bouncing around. This is like experiments. And the thing that I like about the functional components is it it helps things obviously improve and function, but it's also a little bit of a diagnostic. Like, oh, this made me feel significantly better. If it makes you feel a little bit better, it's like, it's like a little bit of a tune-up, you know? But if it made you feel significantly better, then obviously there's a little bit of an issue there, and we might need to do a little bit of treatment, right? And so let's go ahead and pull out Pomarosa if you have it. If not, maybe some sort of geranium or one of the digestive oils like ginger, anise, tarragon. Pomarosa is what you would use to treat this if you did have it, though. Oh, we got that in. Everybody's okay.
I just want, like a logistical question. It's come up a couple times. Somebody's asking, is it better to lay down when doing the inhalations or sit up, or does it matter? And I've had it come up a few times, even just
Yeah.
this week, so I thought maybe we could just.
Yeah, I mean, it kind of depends on where you are at. Like, here we're really trying to relax and rehab the gut. You're going deeper into rest and repair mode. So, I mean, you don't have to, but if you lay back, you'll probably get a little bit more out of it. I mean, half the time I'm sitting up and half the time I'm laying down when I'm doing processes, but it kind of depends on where I'm at. If I'm tired, I lay down. If it's like, I'm a little wound up, it's hard for me to lay down, and so I sit there. But usually what happens, I start doing a process and then pretty soon I'm like, oh, I think I'm gonna lay down, So I would say, just kind of go. I don't know that sitting up is diminishing the effect, but usually you're able to let go more if you're laying down or slumping back in the chair. You know what I mean? You're kind of allowing your body to go into repair mode, and so you are going to get more relaxed and so I hope that helps. Yeah. Yeah. Okay, so Pomerosa is the primary choice. I gave you some B choices there for doing this process, and your awareness is on the front solar plexus, that area below your ribs on your upper abdomen. Take some nice, long, slow, deep breaths with your awareness on the front solar plexus. Now, if you had this issue or this is something you wanted to treat, I would do both the breathing process and taking it internal. Nice, long, slow, deep breaths. You're on the front solar plexus. You're taking nice, long, slow, deep breaths. Move your awareness to the back solar plexus, the mid back area, the area below your shoulder blades. Your awareness is on the back solar plexus. You're taking nice, long, slow, deep breaths. Your awareness is on your navel. Long, slow, deep breaths with your awareness on the navel. And then the bottom of your tailbone. Your awareness is on the bottom of your tailbone. Now, let the breathing go for a moment, and we want to practice here abdominal awareness. And it's a little bit harder than other parts of our body because we don't have quite the sensory nerves in the gut that we do in other places. But we can have areas of discomfort. It doesn't mean that pain can happen there, but it usually comes from cramping, compression, a little twisting, inflammation. It's not how it is like with our skeletal muscle. So, what I'd like you to do is just take a moment and uh, observe your abdominal area and just feel if there's some sort of discomfort, some sort of agitation, somewhere where your attention is drawn, and go to that area in your gut. It could be low, it could be high, it could be off to one of the sides. And you're observing it, your awareness is there, and start taking long, slow, deep breaths with your awareness on that area. Let's be very specific on that area. And then just be still. Just be still and let it go for a moment. Then let's do another cycle. Your awareness is on the front solar plexus. Your awareness is on your back solar plexus, your mid back area. You're taking nice, long, slow, deep breath. The navel. Your awareness is on the navel. Bottom of the tailbone. Your awareness is on the bottom of the tailbone. And then just pause for a moment and let's explore the abdomen again. Put your awareness on the gut, the whole abdominal area. Where do you feel something? Go a little bit deeper into that area, observe it, and begin taking nice, long, slow, deep breaths. How are you doing? Knocking you out. Yeah. And then just pause. Pause and let go of the inhalation. Just be still for a moment. Now, let's go back to the abdominal area and still practice abdominal awareness. Where do you feel something in the gut? Your attention is there, and then take nice, long, slow, deep breaths. You're taking nice, long, slow, deep breaths. And then just pause and be still. So before we move to another one, let's go ahead and open this up to questions and experiences. You can unmute yourself, type in. And we're also going to let's do questions specifically about this first, but then we're also going to open it up to if you guys just have questions about anything digestive related. So go ahead and fire away.
And you can raise your hand in chat, and if you don't know how to do that, there's a button if you're on a desktop or on an iPad that says React with a little heart above it. You press on that and you'll see a button that says raise hand, and that's how you do that. And go ahead, Ralph.
Hey, Ralph.
Morning, Greg.
How are you?
I'm doing pretty good this morning.
Good.
Um, so because the last night, I knew we were going to be doing the digestive and
Hmm.
so I picked out some of my old documentation that
Hmm.
you'd sent out before, and under um, digestion, you had we in some of the previous documentation it had peppermint and ginger for digestion. Are those specifically gut lining, or do those two
No,
oils?
that would be just for the process of digestion.
Okay,
Yeah, yeah.
but neither one of those two would specifically address the linings.
Not necessarily the lining. Because the issue with the lining, a lot of times, even though ginger and peppermint are anti-inflammatory, the the issue is not really like going after the inflammation in the body or inflammation in the gut, but like here we're just looking at how to repair the lining of the gut when it's already been compromised. And it usually takes a lot of inflammation in the body to get there, like a lot of inflammation in the gut. And
Okay.
so the byproduct can be either because there's an autoimmune issue somewhere else in the body,
Mm-hmm.
something else going on somewhere, or there's just a lot of inflammation. One of the big contributing factors that I used to see, way back in the day was when people had like a bone on bone situation with either the hip or the knee. And
Right.
the inflammatory material would just, at first it's very, very localized in the hip or the knee, but at some point it just goes
So,
systemic. And one of the areas that really settles in is in the gut. And so it wreaks havoc on that. And the longer our body has a lot of inflammation, the more that these linings kind of become stretched. And so the pomarosa is very helpful. I mean, ginger and peppermint would help reduce the inflammation in the gut, but the lining wouldn't necessarily be like rehabilitated. And I would say like this is more about rehabilitating the lining. And so the idea of using I mean if somebody really had an issue, I would do both Pomarosa and the Bacopa. The Bacopa is just incredibly good for the lining of the gut. And it even reduces some of the inflammation somewhat. But you're wanting that gut to like go from like if this is all tightened up and it kind of stretches where things start passing through, it actually makes the inflammation in the body get worse because now things are leaking out of the gut. It's going into the digestive tract, but it's also starting to hit other areas in the body. And, the level of inflammation escalates quite substantially. So, I mean, in a way, it's not treating the overall body inflammation, but you're treating an area that's been impacted by inflammation. But when the body goes into a very deep and like inflamed state, it's a downward spiral that just the inflammation kind of keeps building on itself. And one of the areas that you really want to calm down is the lining of the gut. And
okay.
so this is a way to kind of rehab that and like tighten up the walls or the lining so that things aren't passing through the gut, or through the lining, I should say.
Okay. So on a parallel track, then, inflammation in my old book here, or in
Hmm.
my old handout, it suggested frankincense, helichrysum, or yarrow for inflammation. So would those three be something to use in
Yeah,
addition to the
sure.
bacopa to
Yeah,
address the general inflammation in the body, as well as addressing the problem in the gut?
it wouldn't address the lining, but it
Okay.
would reduce inflammation in the body. And and since then, I would say also like blue healer, German chamomile, black cumin, turmeric,
Mm.
All of those things could be thrown into the mix. Even ginger could be thrown into the mix of reducing inflammation in the body. But
Hmm.
here, like we're looking at what has happened to the lining because of the inflammation. So if you're wanting to address the inflammation in the body, yes, you would use those oils, like something of that nature. And then here you're going through and you're putting a little bit more under the microscope and go, okay, but let's undo the damage that's been done for the inflammation in the gut lining. And, a lot of times people might be somewhat aware of it, but not like super aware of it. And so, that's one of the things that I like to do is just to go through and treat it for a little bit and go, do I feel better? And if I feel
Hmm.
better, I'm like, I might have a little bit of an issue there. And so, if you've had prolonged periods of inflammation, it would be a thing that wouldn't be the immediate thing to address. But once the inflammation starts calming down, I would go through and go, okay, let's check the gut. Let's see how things are doing, how things are feeling. And, especially if there's been a lot of inflammation in the digestive tract. But if you have one of the things that are like, I don't want to call them a red flag, but
You know, you got a problem.
yeah, a condition of interest. You know what I mean?
Okay, that's a
Yeah,
polite way of
yeah,
saying it.
yeah. So like, any sort of like bone on bone issue, super bad inflammation. One that I used to see this a lot was like probably anywhere from 6 to 12 months out from a really bad, when somebody would go through a really bad car accident or like a really bad fall or, where they had some bodily injury that was really substantial. At first
Mhm.
you're like, there's broken bones, there's torn muscles, or there's, strains, or, you kind of start going through and resolving
Yeah.
all of these things. And then,
Get the
later,
triage done, and then now we got to figure out,
right.
fix what happened. Yeah.
Right. And then so then after that you start going, okay, is everything okay? And then you start looking like, are they starting to develop high blood pressure? Are they starting to have digestive issues? Because like that was the thing that I always found pretty interesting is that almost everybody that had a substantial whiplash down the line develop digestive issues, but you don't really put two and two together. You know what I mean? But like
Yeah.
when
What's
you
your neck got to
have
do with your gut, right?
right, like you wouldn't think about that, but then when you see like, okay, I've treated 400 people, and what's that like old commercial?
399 of
Four
them
out of
suddenly.
five people have like digestive issues, and I would say it's probably more like 9 out of 10. Like
Yeah.
it was substantial. And
Okay.
when I was doing all that whiplash work, I was doing it with an ER doc. And I went back to her with that information, because again, she's seeing the immediate injuries. We're
Hmm.
not really looking at it like a year out, 5 years out, 10 years out. We were looking at treating things, based on the accident itself. But I was like,
Hmm.
some of these people that I'm treating, they've, they've had the accident. It's been more than 6 months, but some of the people were like old whiplash patients. So, or people who had had whiplash a long time ago. So 4 years, 5 years, 10 years out. And I'm like, I'm seeing a pattern through all of this. And one of them was that there was substantial digestive issues in almost the entire population. And, it really made us kind of step back and go, ugh, that's kind of, a big issue. And really that was this is a long time ago. So we're aware of vagal tone, but we're not aware of how we think of vagal tone now. Like vagal tone back then was like, yeah, it was a thing to take into consideration and it was a thing to think about. And, yeah, the nervous system, but we would kind of go, yeah, it's a thing to check, but then we would blow past it. And it's one of the big things that made focusing on vagal tone become for me
Yeah.
a much bigger issue. Is like it started to make sense that boy, the body goes through a trauma. Ugh, look what happens. It's not just the immediate situation and you get over it. There's an ongoing momentum or effect that gets sent through the body that needs to be undone. And, I got to where if I had a new person come in, a new patient come in with whiplash, we'd stabilize them. But I was like, we have to start treating the digestive tract. And they'd go, I don't have digestive issues. And I was like, not yet, but you will.
Yeah.
And, people would push back a little bit. Not everybody, but people would push back a little bit. And one of the things that we started doing is that when people would come in with a whiplash, I started giving them digestive enzymes in between their meals. Instead of them taking it with their meals, I was like, let's just try something. And we started giving them digestive enzymes between their meals. And um, I almost always got them off pain meds doing that. I would get them off pain meds and even like ibuprofen, Anaprox. I don't know that Anaprox was a big thing back then. I think it was more ibuprofen. But would get them off like kind of anti-inflammatories or anything of that nature that was like a low grade pain reliever. And it's just they didn't need it anymore. The digestive enzymes were acting like ibuprofen would. And, again, the more that we treated the gut, the better that the person got usually. Not every time, but usually with a traumatic event. And so I come back to the lining of the gut where, you know, it might be a physical trauma. Sometimes it could be a very strong, emotional or mental trauma, but it's going to impact the gut at some point. It might not be immediate, but eventually it's going to impact the gut. And so if there is been a lot of inflammation, I'd almost bank on that the lining is compromised some way, somehow. So, you still have to go through and treat some of those other things. If like they had a bad shoulder injury or a bad neck injury, we would still need to treat the neck and, whatever that might be, or if they, had a bone on bone issue, treating that became primary. But then a little bit down the line, we go, okay, but let's really double down on the gut. And if you think about it, Ayurvedic medicine is all about the gut. I mean, it's a whole therapy system of like, let's just focus on the digestive tract, and basically how you treat other things in the body is by refining the treatment of the digestive tract. And I mean, that's how profound the digestive tract can be in these areas. And so the idea of hitting the lining is really just a byproduct of when the body's gone through some significant inflammatory process. Just whatever, however, why ever, you know, it can happen. And, every once in a while it can be age related, because usually at like the age of about around 40 and the age 60, our body goes through an accelerated little phase of aging. Just how like when you're young, you go through a little growth spurt.
Mhm.
It's an
You get the
accelerated.
same thing on the downhill side.
Yes, exactly. That's exactly where I was going with it. Like you go through an accelerated aging process where boom, all of a sudden you grew 3 inches and 3 or 4 months or something. And you know, that still happens later in life. It's just that it pushes you downhill faster. You
I
know what
got
I
that T-shirt. Yes.
mean? Yeah, yeah. And
Okay.
so
Okay. So, quick question on
mhm.
digestive enzymes because you mentioned it.
Uh-huh.
Wobezyme. Do
Yeah,
you
Wobezyme is
so currently Amazon is sold out of Wobezyme, and I've looked in a couple other places and they don't have any right now
really
either. Is
Oh,
there a B choice for rhombozyme while it
I
comes
would
back
just get
in?
a kind of a broad spectrum enzyme,
Okay,
digestive enzyme.
just a good broad
The,
spectrum.
the
Okay,
very first thing that we did was bromelain. And it worked. It wasn't amazing, but it worked. But then when we started going to like a multi enzyme, it got much better results. And so
okay,
I would say,
all right.
just some sort of broad spectrum. I would say the thing to watch with the enzymes is that sometimes some of them will have like a HCl,
Mm-hmm.
which is the stomach acid.
Right.
Increases, and not everybody tolerates that well. And
Okay.
like you're okay if you're depleted, but if you're not depleted, all of a sudden, it's not pleasant. And so I'd probably get one that doesn't have that.
Okay.
Yeah, yeah,
Okay.
yeah.
Good.
Boy, I didn't know Amazon was out of those. That's
No, well, they come. The Amazon comes and goes like everybody else, so I'm not too worried about it. I'm pretty sure it'll come
yeah,
back.
yeah.
It's just in this 10 seconds when I wanted to get it, they didn't have it. So
Right. Gotcha. Okay.
yeah,
Yeah.
yeah.
You might be able to find it in a local health food store. I mean, health food stores,
Not down here.
oh, that's true. You're in Mexico.
Yeah.
Yeah. Yeah. Okay.
No, I'm not giving up. I'm just looking for a B choice while I can before so I can restock.
Okay.
Yeah.
Yeah.
Okay. Good. All right. Excellent. Yeah. I'll work with that. Thanks.
Good, good.
And then go ahead, Robert, then Laura.
Hey, Robert.
Hey, Greg. So sort of following up with what you were just talking about with Ralph, I remember I've had two significant automobile accidents in my life. One was
Hmm.
about 3.5 years ago, and the other was about 50 years ago.
Hmm.
And
You're not that old. Come on.
thank you so much. Uh, I was barely a child. I
Right. Yeah.
wasn't allowed to drive. No.
Right.
Um, but I think back now about that early accident. That was what sort of changed how my body worked.
Right.
Before that accident, I could eat anything and everything, and I was thin, and uh, I had to eat a lot just to keep weight on. And
Hmm.
after that accident, and I didn't recognize this pattern then, I recognize it now looking back from your conversation with Ralph. After that is when I began to gain weight and not be able to lose weight
Right.
easily and
Right.
maintain weight.
Right.
Uh, so my question is sort of the treatment of that. So obviously some of this is gut. There's probably other things as well. But if I were
I
to
would say a lot of that is gut. Yeah, I would say you could probably focus on just bouncing around and treating different things. I like the idea of this, given that you had significant issues, is, you know, it's kind of a weird thing. It's like if the lining kind of stretches out like that, and then later the like the neck and the back and the shoulder all got better. It doesn't mean that the lining goes, okay, we're good now. Let's go back. It just kind of stays like a little stretched out. And and the thing using the Palmarosa and the Bacopa is really good for the lining. I mean, Palmarosa is too, but I'm becoming more and more impressed with Bacopa as I've been using it for more than just the brain. And the thing that's nice with doing it in conjunction with the Palmarosa is that both are helping to like firm up the lining of the intestines, but also the Palmarosa is also helping to diminish negative bacteria in the gut and increase good bacteria or friendly bacteria. And so it's not just the lining is firming up, but also like how the digestive tract works. I would say that would be a component. And then another component of it would just be the stomach movement. Sometimes that gets very disrupted, and we eat food and it doesn't move through like it should. And so the thing that really improves the peristalsis is cinnamon. Cinnamon is like a like a rejuvenator of the muscle movement through the digestive tract. And I would probably focus on the lining first, and then you could follow up with a cinnamon. But I would bounce around and treat a bunch of different things in the gut. The lining being a big piece, but it's that idea of just the like a stress plagued gut is, it's just a fancy way of saying it's got poor vagal tone, and not just poor vagal tone, but uh like you almost become, because of the injury. I mean, if you think about, like, your body goes through the injury and your body freaks out. Like, your mind and emotion are like, oh, that was bad. And yeah, I'm getting better. And that was a freak event or whatever. But the body doesn't know that that's not going to happen every week. It doesn't know that it's not going to happen tomorrow. It just thinks like, hey, this thing happened. It could happen again. And so it goes into like a red alert mode. And, you become a little bit more sympathetic nerve dominant. And so it's yes, there's like poor vagal tone, but over a period of time of being sympathetic nerve dominant, is that eventually that nerve also fatigues. And like when that nerve fatigues and starts to lose tone, it still causes disruptions, and vagal tone's not necessarily going to improve it. And so that's why, like, things like rosemary and anise, they're very good for toning up the sympathetic nerve so that it regulates. Because, like, if you think about like how we are when we're tired and somebody comes and asks you to do something, like, like, hey, could you take out the garbage? And you're exhausted and you're like, I'm not taking the garbage out. Like, you just like have a little bit of a meltdown. Where if it was morning and you're rested and you go, yeah, sure, I might not want to, but I'll do it. But when you're tired, you almost have like a overreaction. And when when either side of the nerves get depleted, they can either significantly underreact or they can significantly overreact. And your vagus nerve, in vagal tone and rest and repair mode, usually doesn't overreact; it underreacts. Sometimes you can go into such deep sleep or deep repair mode that it's hard to become functional. I mean, it can happen, but usually the when you become sympathetic nerve dominant, you become like hyper reactive. Like your body just reacts quicker and quicker and quicker and quicker to things, because it's in that state. And so um anise works, rosemary works really well for reestablishing tone there. Tarragon can even do it a little bit as well. One that's a little bit of a sleeper that I haven't mentioned before is, we've used it in different ways, but neroli actually can be very toning to the sympathetic nerves. And it's something that you would use for like even like kinds of shock and stuff, like how we use tarragon or benzoin or rose or something. You could use neroli in that arena. I mean, I think the other ones work better, but it would still work. But part of how it calms the body down is that it brings greater tone to the sympathetic part of the nerves, which makes it less like hyper reactive, if that makes sense. And so when you've had an accident, your body goes into this like fight flight, mode where it's freaked out because this traumatic thing happened. And then a month goes by and it's like those like those old movies where you see the guys in the war in the trenches smoking cigarettes and their hands are shaking and they're like chewing on their fingernails. It's like, the gut starts to do a version of that. Like it just doesn't recover from that until you manually make it recover. Eventually things like maybe calm down somewhat, but um that could be dependent on the health of the person prior. But if the injury is strong enough, it'll throw the gut into such chaos that it's really hard to pull it out like immediate. You really have to treat it for a while for it to calm down.
So looking back on 50 years,
Uh-huh.
if I, assuming I start doing Bacopa and Palmarosa, how long am I, how long will I need to take this? Am I talking
Oh, hard to
months?
say. Yeah, definitely probably months. I
Okay.
mean, like more severe cases, it's usually more things like where there's autoimmune issues or there's a really high level of inflammation in the digestive tract. You might need to take it for years. But um, if there's just a moderate issue here, um, I don't know. Like I usually do it. I do it for about like 2 or 3 weeks and then I let it go for a little bit and I let it kind of assimilate and then I'll do another 2 or 3 weeks. And I haven't really ever done it like a straight like 60 days. But the only reason I take a break is I like to kind of see like, okay, I'm feeling a little better. Is it in my mind or is it not? And it kind of helps me to assess like where my gut's at. And then I also want to see like as soon as I stop taking this stuff, do I maintain or do I start backsliding immediately? And um, because I had some bad car accidents, but like uh, accidents in other ways were pretty substantial. And so, you know, as much as I'd like to say, oh, my gut wasn't impacted by that, it heavily was. And not all, like I'm speaking for myself, not all of the traumas were physical. Sometimes there was just very difficult times or, something going on with work that was just a little bit almost like life changing that I was like, I'm gonna have to deal with this. And it was very upsetting and all of that definitely had an impact on the gut. And I don't really ever think about it, but when I go through and treat it, I always notice, oh God, I feel better. Oh, I have more energy. Oh, my brain is clearer. Oh, I start ticking these things off and I'm like, why aren't I treating the gut more? Oh my God. Like it's way more of an issue. But part of it is that you know, usually pain or not being able to do something or lack of range of motion or not being able to sleep, it gets our attention. The gut is very quiet. We don't really have the sensory stuff in the gut. And so we really don't know that the gut is having an issue until it does something to get our attention. We have really bad constipation, we have really bad diarrhea, we have some sort of pain. And so for us to feel pain in the gut, it's usually gotten substantial. We get bad cramping or, something like that.
Is
So I would
so
say the more of like treating it, you know, because you go look at it from a symptom point of view, but even symptoms don't necessarily manifest where it brings your awareness to it. So to just start going through and treating the gut, like the this week I was doing a thing where, and we're going to talk about this weekend, um, where I just started looking at different parts of it, and it's stuff out of the booklet where I started just treating like liver secretion, stimulating the way that the liver function. You know, I just started stimulating different things of the liver, and I was like, my pain levels went down. Like I wasn't aware that I was in pain, but my body is not as achy as it was. Like I didn't think I was achy until it went away, and then I was like, really?
So, what sort of what you're saying, if I understand this right, is there's not really a symptom we can look for to know whether we need to do this segment. It's more we do it, and if we feel better, we should keep
Yes.
doing it. And if
Yeah.
we don't feel better, okay, we probably don't
Yeah.
need it.
Yeah.
Okay.
Yeah, I mean, usually the thing that starts to happen, and see, this can be other causes too. But you know, with leaky gut, is you would have inflammation in the gut, but you would start to have inflammation in other parts of the body. You might start to have an autoimmune issue. Um, People even get these like little like cysts on their body. They look like little like marbles, like just in random places on their body. Not just one, they'll have like, you know, 20 on their legs. And it's food particles that the body has to encapsulate to, you know, maintain. And so usually by the time you would see a symptom, it was pretty bad. And so, like you said, going through and treating it, you know, it's just like you would do some sort of maintenance where you just go, okay, let's check in on the gut lining and see how it does. And you go through and you treat it. And then, you know, if you notice like, God, I feel a little better. Like, you know, my energy levels are up. Like, um, this is a weird thing to say. My like when I do the gut lining thing, my eyes get like brighter. Like I can um uh it's like it processes light better, you know, if that makes sense. Like sometimes if I'm doing stuff in certain parts of the office, it's kind of dark there, and I can't read anything unless I have my glasses. And even then, I have like little flashlights scattered, you know, to be able to read something. Like when I'm pulling something out in an area that I don't do very much. But if I do a bunch of gut lining work, I notice that I go over there, I don't need the little flashlight. You know, it's like it's little weird stuff like that.
And
Yeah.
there's things that we are not taught to look for or trained to observe, so we don't recognize them as possible gut lining symptoms.
Right. Who would think the eye thing is a gut lining thing? You know, the thing that you know, going through and reading my notes, you know, the thing with like dry eyes, we use like Shazandra or we use other things as well. But, you know, going back and reading my old notes and the old research that I had done, you know, we think of it as allergies, which is true, and we think of it as potentially a little bit of an autoimmune issue, but like, you know, just in the eyes, which also can be true. But a big component of it is actually liver function. And um, you know, I kind of forgot about it. Like, you know, as much as I have all this stuff in my notes, I don't always retain it all. So I have to go back and
Right.
like read my notes just like you guys. And I was going back and I was like, I forgot how impactful the liver is. And, you know, this was more my notes from doing healing, and so it doesn't really change the oils that I would use, you know, because the oils still work. I think for that you could potentially add peppermint just to help stimulate the the detoxification of the liver, but it wouldn't be a long-term treatment. It would be very short-term. Shazandra would still be the best long-term treatment, but I forgot how much the liver plays a role. And so I would say I'd still treat the eyes, because it's in the booklet. It says liver and then as it impacts the eyes or something, so it's way down towards the end of the booklet. But if you're having eye issues, I would say even do different parts of work with the liver to impact the eyes. And, I would still use the Shazandra, but I would do other things to treat different aspects of the liver because that's going to improve the function of the eyes. It's going to impact other things too, like pain levels go down, achiness goes down. Um, like I said, I started doing some liver work and I thought I felt amazing. And then all of a sudden I was like, my achiness levels went down and it's, you just get used to it. And somebody asked me if I was achy. I would say, no, I feel fine. And then I did the liver work and I was like, I was a little bit achy. I was achy. And so, part of it is, you know, our ability to perceive that these things are there, we really don't always know until it goes away or something shifts. And so we really don't know. And even an outside, practitioner or doctor or whatever, they're still working with kind of the same kind of information. And so, they're just trying to, okay, do you look, you look good, you look stabilized, everything's functioning well. We've done tests, we've done this. A lot of this stuff doesn't show up in like a test, and so we have to kind of do our own kind of testing. And so to go through and treat the lining, and then you go, okay, do I feel better? Am I thinking clearer? Is my digestion better? And the thing that I would say treating the lining that I noticed is that when I'm eating earlier in the eating, it registers in my brain that I'm full. You know what I mean? Like, you're eating, you're like, yeah, I'm kind of full. Where when the lining is a bit compromised, um, that message doesn't always get to the brain.
That's another interesting symptom too,
Yeah,
because I know that I love to eat, and you
yeah,
put food in front of me, I'll eat it
right,
all.
right.
Uh, I'm not like a dog or a cat that self-regulates their eating. You give me food and I'll eat it,
Yeah,
sure.
right.
So it sounds like I have a little bit of
A
work
little bit of a
ahead of me.
lining issue. Yeah.
Yeah, a little bit of work ahead of me here.
So if you do have that issue, interesting thing is before a meal, eat like a small handful of peanuts. And for whatever reason, it helps the communication between the gut and the brain. Just like not like a massive amount, but just like 15 peanuts or 20 peanuts or something, and eat them like maybe 15 minutes before you eat, and you'll notice that when you start eating, it will register to your brain sooner.
Okay, I'll try it out.
Yeah,
Thank you very much.
you're
Very
so
interesting
welcome.
info.
Yeah.
And then go ahead, Laura, then Denise.
Hey, Laura.
Good morning. Um, Actually, you've answered really well several of my questions with Ralph and Robert. Um, I'm a poster child for what you're talking about. I'm bone on both knees, gained weight after traumatic event,
Right.
dry eyes.
Right.
Dry
Yeah.
eyes.
Yeah.
I literally everything you're talking about, and I love the idea. So I would assume like a organic peanut butter, you could take a spoonful and it would do the same thing.
I would imagine, I would say, make sure there's not like sugar added,
Yeah.
because I think the sugar could throw off
No,
the,
it's just pure peanut
yeah,
butter.
pure peanut butter. I think that should work.
Okay,
Yeah.
so I guess my questions are, if you fit all of those categories, is Shazandra something you take internally?
Yes. Yeah. I
And
mean, you can still do a breathing pattern, but it's going to be most impactful internal.
so could you do these twice if you know that you need Bacopa and Palmarosa, Shazandra, could you do them twice a day or just once a day, or what
No,
would
you
you
can do
do?
easily do them twice a day. Yeah. Yeah.
Okay,
We're gonna take time and we're gonna do this whole thing and discuss the different ways to come at the liver. And you know, like you said, the dry eyes and everything like that. Um, I would definitely say that that is a thing to look at and work. But you know, given the bone on bone, you know, the times that I've worked on you, I always kind of do a little bit on the gut and like do things to like firm it up. But you know, that's the thing. Like when you're dealing with the bone on bone, a lot of times it takes so much effort to like kind of manage that it's not like you need to have like another whole list of things to do. You're like, you know what I mean? It's like really the primary thing, manage the hip or the knee or the, you know, the injury site. But then as it starts to kind of stabilize, I think a good place to go is, you know, obviously lymphatic function, how is that doing? But a lot of times that's even in the management of the symptom. But then a little bit farther, you go, okay, what's been the effects of that thing on my body? Let's try to diminish that. And you could almost always just go to the gut. Like that would just be the thing to do is just go and start looking at, you know, has the gut been stressed? Has there been inflammation? Has there been, you know, whatever's going on? And so I like the idea of looking at the lining of the gut just whenever there's been an inflammatory process going on for a period of time. Just because at some point that inflammatory material just starts to spread through the body, and one of the places it lands is in the gut and the intestines. Yeah.
okay, this is going to be a really good weekend for me. Thank
Yeah.
you so
Yeah, you're
much.
so welcome. Yeah.
And then go ahead, Tracy.
Hey, hey.
Hi. So basically you're just talking about me, right? All this
Well,
this whole
I
thing.
didn't think very many people were going to show up to a class on healing Tracy, but
Oh, and I have noticed the not feeling full.
yeah.
And I'm not a big peanut person.
Yeah, you
Um,
don't have to do that. Like if you just heal the lining, but like, you know, the peanuts are like a weird kind of hack. I think sometimes consuming a decent amount of water before you eat might do it as well. That one's I'm not always sure that it works, but possibly. But that thing with the
Interesting.
peanuts, it's like an old school. I mean, that goes back, I think, maybe 100 years, where you know that was a trick. Like, you know, they didn't use the term hack, but you would just eat a handful of peanuts before you ate, and it would trigger something in the brain.
Wonder if that's why people put it in like Dr. Pepper and Coke and stuff. Put peanuts in it.
Oh, I've never heard of that.
Oh, it's a southing thing.
Yeah,
You just
that's
put
a
a handful of
southern thing.
peanuts in
Well, it's
the
the whole
soda.
boiled peanut thing down there, right?
Yeah, we have a weird relationship
Yeah,
with
yeah,
peanuts. How else can we use
yeah.
them? Um, so, uh, so the Bacoma, is that how you say it?
Bacopa, Bacopa.
Bacopa. Was that in the kit?
Yeah, I think it is in the kit, isn't it? The kit for purchase. I have to look up. Let me look it up real quick.
If so, I've
Yes,
misplaced
somebody
mine.
let me know. Yes, it
Yeah,
is.
yeah,
Oh, okay, okay.
yeah. I mean,
Thank you.
it's like such a I don't know. Bacopa, like you use it to help people recover from strokes and you know brain function and you know if the brains become toxic and you know there's all these things and doing a deeper dive, and then also looking at my notes, because sometimes my notes, that's why I have to like kind of go through and extract things out of my notes, is because I'll just make weird observations, and you know they don't always make sense to me in the moment. But I'm like, I'm just gathering data so that like at some point I go, do I see a pattern? So I'll go, this person this person that, this person this person that. And then sometimes it's just random things for people, but I'll start to see a pattern in some situations. And so, a lot of times a lot of these observations have been over like maybe 20, 30 years. And so, I go back and read my notes and I'm like, holy crap, da, 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 da. Like I didn't really, because you're dealing with something in the moment. You don't really think about like what are the long-term effects of something and what's the pattern. And so, um, that whole thing with even the communication between the gut and the brain, um, that didn't jump out at me right off the bat. Like I started reading my notes and I was like, oh yeah, that's a thing. Like that is way more of a thing than I thought, because it's at first it's like, okay, let's look at substantial injuries. Let's look at substantial areas that are compromised, like bone on bone. And you start to go, okay, I start to see a little bit of a pattern. But what happens if you just went through a lot of emotional difficulty and things were inflamed, but out there? It still kind of has an inflammatory effect on the body as well. And it would still impact the body in a way that a car crash would. It doesn't make sense to the mind, because you just go, yeah, that's out there. That's not me. That was a situation. I've walked away from that situation, but your body sees it in a completely different way, and your body sees that as an injury, the emotional situation that went on for, however long, intensity, years, whatever. It sees it as a physical trauma, just like the car accident. It just feels like something in the environment makes me feel unsafe, makes me feel unstable, makes me feel upset, makes me feel defensive, and then manifests in the body. And so, starting to go through, like, I didn't make notes about that right off the bat. But, it was several years later, I started making notes and I started noticing like, uh, emotional difficulties, substantial emotional difficulties manifested in the body, almost just like a car accident. You know, there was, for the body, there wasn't a big difference.
I could see that.
Yeah.
So, black cumin, how does that help with the gut, or is
It helps with the inflammation. It doesn't really rehab the gut lining,
okay?
but it does reduce inflammation in the body. It stimulates the healing processes. It helps with improving vagal tone, all those things. But, even though, we get those things in motion, sometimes it's like, okay, those things are getting better, but now got to clean up the crime scene. And so the idea of going after the lining is kind of cleaning up the crime scene, so to speak. Like, yes, I'm reducing inflammation. Yes, I got my hip and my knee in place, or my neck in place, and it's doing better, and it's not as inflamed, and all of those things. But then you go, okay, now if I step back and I look at it from a different perspective, what is still being an issue, even though those things are reduced, and you go, got to look at the gut lining, like the issue of inflammation in the body for a period of time. It's almost always going to impact the gut. It's just like if your shoulder gets, this is one of the things that we saw like a lot of times in whiplash patients. Like at first they would be a little bit like, oh, my neck hurt, this hurt, that hurt. And then about maybe 3 weeks out, this would happen. Like a shoulder would drop, right? And it wasn't immediate, but what was happening was that area was so inflamed that at some point, one area would lose muscle tone. And it wasn't that the other shoulder went up, it's that the one shoulder would just lose tone and it would just drop. And so eventually it would cause the other shoulder to go into a like a spasm, because the other shoulder's trying to compensate. But what happened was inflammation was so bad that that area lost muscle tone. And so the same thing happens in the gut and the intestines. At some point, the inflammation becomes bad enough to where the shoulder drops. Like here, it would be you lose the strength of the lining of the gut, and it starts to stretch, and then it doesn't do the things that it does, and then food starts passing through the lining.
So is it better to treat the inflammatory response first and then the lining, or does it matter?
I would try to get a handle on the inflammation. Yeah.
Okay.
Like
Yeah.
I mean that's always like the first primary thing. That's the triage. You know,
Okay.
if there's a lot of inflammation in the body, get it under control. But at some point, because it becomes a chicken or the egg first. Like if the lining has lost tone and food's passing through, it's now contributing to the body inflammation. And so you start kind of treating the body inflammation and the body starts getting better, but then it's like it gets better, but it only gets better so much. Like, it doesn't so there's still other things to look at, but the big thing to look at is go, okay, how is the stomach lining? How is that impacting the inflammatory processes of the body, but also of the digestive tract. And so you go through and kind of firm it up. And so that's why this is under like a functional thing, uh, functional processes, so that you can almost use it as, okay, if I treat it for a couple of weeks, how do I feel? Do I feel a lot better, decent? I don't really notice a difference, because there's not really a way to check in with it. And so you go through and you treat it for a little bit and you go, oh, I'm feeling better. Like my digestive system's functioning better, my brain's clearer. You start looking at just how it's manifesting in the body. And there's not always like this checklist where you can go, this, and this. You just notice like, I'm feeling better. Crap. It's an issue, because functional issues are a lot quieter than a symptom. A symptom is a byproduct of the functional issues being so out of whack for a period of time that it's producing a symptom or a medical condition. It's come to a head, so to speak. When you're treating functional issues, you're just looking at like, how is this making my body function better? And you start noticing like, oh, I'm not as achy, I'm not as whatever. Then good chance that that's what that is, you know. And I would say, it's what we've been talking about for a while about rotating things is, bounce around, treat a bunch of different things in the gut, and then come back and see how you feel. And, usually you're going to feel better on some level, but you might feel a little bit better, and some people might feel like amazing, like I feel so good, right? And even if you step back and look at it from an energetic point of view, like say you're trying to do things to purify the emotional body and the solar plexus, for example, you clean it and you clean it and you clean it, and to a certain extent, only so much comes out. But like even if you're doing it with energy, if you clean the organs, it can't come out fast enough. So stress and emotion is in the digestive tract, just like inflammatory material. And so going back to the emotions and the stress that happened from an accident, the going through emotional difficulty or a substantial amount of stress, it settles in the organs just like inflammatory material. So it's not always the traditional inflammation, like a hip or a knee or an injury. Sometimes it's the environment, sometimes it's the workload, sometimes it's, difficulty, sometimes, society goes crazy, whatever. Sometimes it could be a reaction to a medication. It could be all kinds of things that settle into the gut and cause some sort of problem. And so it's hard to put two and two together. Like, had I not seen, 400 patients with whiplash, I don't know that I would have put two and two together about um, people with whiplash also are going to have a digestive issue. Like at first, I was like, oh, this is weird. This is random. Oh, look. And then I remember thinking, oh, a lot of people have digestive issues for some reason. And then more time went by, and I was like, I started going, did you have digestive issues before? And they were like, no, not at all. Like, no, I could eat whatever, I could, whatever that is that they would say. And I started noticing, like, not only do they have the issue, but it's at a certain amount of time afterwards. Like, it was this window that if it was going to manifest, it manifested in that window. And like, if you look at Robert, he goes, I go back, 50 years, and my digestion changed shortly after that accident. People would have stories like that. Before the accident, I was fine, but then I started, and they would start saying these stories, and I just started, this is starting to be too much of a coincidence. And, like I said, we didn't know, vagal tone stuff wasn't really talked about very much back then. I mean, it was part of osteopathic practices and things, and so I was aware of it, but we weren't looking at it that hard. And when I started seeing these patterns, I was like, ugh, this seems like neurological. This seems like inflammatory. I started just making a list of all the potentials. And it's when vagal tone started becoming like way more on my radar, way, 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 way more on my radar. And now looking back, it's so obvious, but back then it wasn't obvious. It just wasn't. We didn't think about it that way. I say we, it's like the collective philosophies at the time,
Oh, yeah, we
Yeah.
never, even when I went through massage school,
No,
we
you
never
didn't think
really
about
talked
it.
about it.
No,
Mhm.
nobody talked about it. Even when I was doing research on it, it was most of it was in Europe. Europe was a little bit ahead of us and looking at the the effects of the autonomic nervous system and vagal tone, way back in the day. Yeah.
Makes sense. Thank you so much.
You're so welcome.
And then go ahead, Denise, and then we have chat questions as well.
Hey, hey.
Hello, good morning. Um, I had kind of a twofold question. One was, could you lead off like with a gentle liver cleanse first and then move into doing some inflammation and then on
Yeah,
to,
sure.
would that be a good,
Yeah, you could do any version of it. Like, and we're gonna go into the different things to kind of target. One of the things that I was liking to do is to impact liver secretions. And if I remember right, it's hyssop decumbens. And like the other hyssops, hyssop decumbens is the only one that has a different chemotype. All the other hyssops just come from different regions, but hyssop decumbens is a little bit of a different chemotype. And for whatever reason, it jumpstarts the secretions of the liver. And so, like, if you were wanting to get the liver rolling, is you could do two things. You could use peppermint to jumpstart the detoxification process. Peppermint will jumpstart it, but won't take it deep. Like, other things you'll want to take it deep. and then the secretions, which is the hyssop decumbens. And the thing that's nice about hyssop decumbens is just inhaling it will do it. You can inhale it with your awareness on the back solar plexus and on the liver. That might intensify it a bit, but just inhaling hyssop decumbens makes the liver secretions improve. And so long periods of sustained inhalation will definitely jumpstart those secretions and improve liver function. And so again, I would say bouncing around to different areas just to see like, okay, let's just get things moving. Let's get things improving, and then we'll keep fine tuning it.
Right.
Plus, you're getting to become more aware of your body and what's really impacting you. And so that idea of bouncing around like what you're talking about, I think is a great idea. And it doesn't necessarily have to be this is the first, this is the second. I would just start, it's almost like playing. You just get in and start playing with stuff and then go, okay, what's making me feel better? What's not? And I would say at least give things a couple of weeks of treatment. And if it's starting to make it feel like something's like improving, I'd go at least 30 days. If not a lot's happening, it's like, I'll move it on. But like the liver secretion with the hyssop decumbens, I did it, and within 2 nights, I was like, oh yeah, I'm going to be doing this for a while. Like, and I haven't done it every night, but I've done it probably the last, I don't know, last 2 weeks. I've done it probably 12 nights. And so, sometimes I'm too tired or sometimes I'll forget or something. And, at the end of the day. And so, I would visit everything. Like I just like look at different things. And that's the thing too is, we have usually if you've been doing these for a while with classes and everything, you have a bunch of oils laying around. So you could go,
Yeah.
what in my kit can I pull out to do this? And so it's just a way to kind of pull things out of different kits and go, let's see how this is going to impact the digestive system and how does it make me feel? And so, even the idea of that we started these deeper dives with the digestive system, the very first thing I was going to do, I was going to do the respiratory system. And I was like, yeah, I know we talk about the digestive system a lot, but it still feels like it's undertreated. Like, it's like I said, Ayurvedic medicine, the whole principle is treat the digestive tract and everything else gets better. And I was like, maybe we need to start with the digestive system.
It makes sense, because at least with where I'm at in age, I've had a number of head injuries and a number of accidents, car
Mhm.
accidents. Well, a couple. And then that horse falling on me was really very significant.
Oh, yeah, I would say that's super significant.
Yeah, there wasn't a part he didn't roll over. So um, I kind of bled behind my left eye, and my neck was involved, and I bled into my abdomen,
Oh, wow.
So yeah, it was the whole left side. So I don't know, maybe that's what's going on with the left side of my face and skin. Anyways, the other one was, how let's just say, as I got over that accident, it takes quite a while for you to kind of register that the body's healing. Do you know it? There's like a lag
Mhm.
time. And now as we talk about this, I can't help but wonder if there aren't really other areas like that lag time, or other areas that would love to be addressed, or maybe we'll wait till another time. But that could be the lining that shows up emotionally, it
Right.
it goes down the chain. So you really are cleaning up the crime scene, even and talking
Right.
about all this and bringing it to our awareness.
Right.
Thank you so much.
Because like the thing, especially in the West, we're very symptom oriented. It's what like we've been talking about for a while. And so we usually don't address something until a symptom is there. And then even when it's there, we go, okay, how do I make the symptom go away? I want the symptom to go away. When usually it's a byproduct of some functional issue that's, you know, generating that symptom. And so even the idea, it's not that we shouldn't look at symptoms and treat symptoms, you know, because sometimes they're acute and you make them go away and it's good. But still, like what is contributing to that symptom arising? Like why is that becoming an issue? And so when you start looking at the functional components and you start going deeper, then a lot of times not only do you feel better, but it eradicates the symptoms or it makes them more, it like makes the treatment of the symptoms much more effective, you know, because sometimes you'll treat a symptom and it's like, this is supposed to get better with, you know, when I use this substance or whatever, or do this healing or whatever, and it's not getting better. Why isn't it getting better? There's something that's contributing to that symptom. And because the system is not being addressed and the function of the system not being addressed, that symptom is just going to continue to manifest. And so it's like a way to kind of lift up the hood and go, okay, what's making that funny noise in the car? What's making that funny noise in my body? Like, you know, and it also makes you more aware so that you catch things before they become like a blown up symptom in the body. You're going like, you know, I'm feeling a little funny. Oh, I noticed that when my lining is like this, you know, my brain gets this way or that, you know, because you've seen when you treat it, it gets better. So then, you know, like, oh, this is all related, right? So then when you start to have a little bit of a backslide in some area, you're like, the lining of the gut, I got to treat it. Or the liver, got to treat the liver. Or, my kidneys, whatever it is. And so it, 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 it helps bring an awareness. You're connecting your mind and your body in a way that it usually has never been connected before. You know, because they're speaking two completely different languages, completely different. And it's like you're starting to listen to your body, and just the act of listening to the body puts the body into a deeper state of healing. You know, even if you did nothing and you just go, okay, I'm going to practice awareness on the different parts of my body. And you start to go, oh, there's agitation there. Oh, there's agitation there. And you like observe it, like how we do in some of the meditations. Just that is starting to calm the emotions and starting to calm the mind, because the body generates those lower emotions to get your attention. Like, hey, look, you're in danger. You need to be angry so that you fight better, or that you need to be afraid so you run faster, you know, whatever it is. And so if the mind doesn't pay attention to the body, then the body goes, apparently I need to scream to get your attention. So not only do you need to be angry, you need to be super angry. And not only do you need to be afraid, you need to be super afraid, right? So the more that you kind of spend time listening, the more you go, oh, I'm starting to get a little upset. Oh, something's going on. Something out there, something in here, but something's going on. Your body doesn't feel like it needs to throw a fit.
Mm.
You know what I mean?
Yes, yes. These classes are wonderful because
Yeah,
they
good.
are fine tuning that process, the whole
Yes.
process, and us listening much better.
Yeah, good.
Thank you so
You're
much.
so welcome.
And we have some questions in
Sure,
chat
sure.
as well. Does abdominal area include liver and gallbladder?
Yes. Yeah.
How many times a day should we take Bacopa?
I would say at least once a day, but I would probably do it twice a day. Like when I do it morning and night. Yeah.
we have the Bacopa tincture
Mhm.
and we have the Bacopa oil.
Mhm.
Would you take the Bacopa oil like 1 to 2 drops internally
Yeah, if
for
you're
the
gonna
same
if you're
idea?
gonna work with bacopa oil, you could do 2 or 3 drops internally. Yeah. Yeah. Actually, that's one I could have listed here.
My stomach was rumbling so much during this. So interesting. Wasn't expecting that.
Yeah, rumbling is actually a good sign. Like it feels like, oh, that's probably something I need to get rid of. But like when it starts to rumble and stuff, that's actually a good sign.
They're wondering, would it indicate like by stat?
It probably the lining probably could use a little low grade treatment. You probably don't need to do anything over the top, but if it started rumbling like that, it's um, you know, I go to this person who does therapy on the skeletal muscles, but he's also like an Ayurvedic guy. And, when he does work, he's always like, one of the first questions he asks me, did your stomach start rumbling more? And, it's even with manipulation of the soft tissue, like, your hip or back, or especially the muscles of the abdomen, one of the things you look for is there an increase of, that activity, because it just means that things are working and things are moving and shifting, and also the greater connection between the gut and the brain.
And then this brings up a really good question. I'm gonna do like a broader question from this. How to use the tincture of Bacopa or Palmarosa? And the reason I'm kind of bringing this up is because we're doing a digestive class and a lot of them are methods of application are going to be internal. And so Greg will tell you how to do the tinctures. We'll do our best to say the method of application as we go through the process. Obviously, we're doing the workbook as well, and it does say as well in that. But just as, just kind of a blanket overall statement, when we say taking things internal, we're referring to our plant prana oils, not anybody else's oils.
Yeah, like if you're going to take essential oils, just make sure that they're genuine. If they're not plant prana, just because they say pure doesn't mean that they're genuine. They can still be manipulated and things. And so if you're not sure, I would just use them as inhalations. But if you're going to take them internal, I mean, I would make sure that they're something that you can take internally.
And because these questions were asked a little earlier on, you may have already answered, but what is the method of application for the tincture of Bacopa?
A dropper full 2 times a day.
And the application for Palmarosa?
And it's in the booklet as well. 2 to 3 drops in water taken internally. You could do that once a day. You could do it twice a day. Usually people only do that one once a day, but when I do it, I usually do it 2 or 3 times in a day.
When you were back talking about the Wobazyme and finding like substitutes, someone's asking, what about Revly? I don't know if you're familiar with that.
No, I'm sure it's fine. I haven't heard of that, but that doesn't mean anything. I haven't really looked at them. I mean, once I found Wobazyme, I didn't really look at other things. So, but if it's broad spectrum enzyme, yeah, that would be great.
Is the liverwort Greg is referring to in this booklet?
Yes.
Any specific peanut? Any other nuts work on the appetite?
The peanut. Yeah, just the peanut.
And then when you were talking just now with Denise, you mentioned the hyssop decumbens and the peppermint. That method of application for the hyssop decumbens you mentioned is inhalations.
Yes.
And then would the peppermint be a couple of drops internal?
Yeah, and we're going to talk about it either later today or tomorrow. Yeah, we're going to do a whole little section. It's towards the back of the booklet.
And we did send that workbook PDF to you guys this morning, as well as here in the chat. If you didn't get it, just let me know. And go ahead, Letty.
Hey,
Hi, Greg. Hi, Sam. Just really quick, because I know people are asking on stuff on the booklet. I'm missing like a little section at the back. I'm gonna send it in a minute. And then also just really quick, there was something I had emailed Sam. There was a section that was missing, and when you sent me the notes again, I felt like that little part was still missing. So I'll send her a chat, and that way you can look at it over the break.
okay.
Thank you.
Thank you, Letty.
You're
This was
welcome.
a lot of work, yeah.
Yeah, it was it's extremely like very like there's a lot of good information in there, especially if you love to read. But I feel like it was on an encyclopedia of the digestive tract. But either way, it's real all good information. So thank you so much, Greg, for this.
You're so welcome. Thank you for all your hard work on that. Okay, so how about we'll take a break? We'll come back in 15 minutes, so at 20 after, and we'll tackle another functional issue. Hey, everybody. Let's come on back. And we are going to go to number 8, which is irritable bowel syndrome. And I think we all know a little bit about irritable bowel. It's usually when we vacillate between like loose bowel movements or diarrhea and then constipation. But there's like bloating, urgency, and there's a lot of times abdominal pain associated with it. And at first we might not realize that, hey, we're starting to go in that direction. You might get a little bloating and, you'll get a little abdominal pain. You go, that's weird. I got a little cramp. And then, 3 months goes by and you go, that's weird. I got a little cramp. And then pretty soon, it's 2 months went by and then 1 month went by and then it happened twice in a week. And so the thing with this is I do like to treat this just to make sure that everything's toned because we all have a potential for this. And, later there's uh, kinds of colitis and things that, where it's a spasmodic colitis, which is even beyond irritable bowel. And so I like to kind of knock this out right off the bat. Because if this is an issue, it's easier to treat when it's just acute from time to time rather than that it's starting to go in this direction and become much more of an issue. And so there is a blend that we make, IBS blend, but geranium is actually incredibly good for this. Rose geranium, peppermint can be good. And one that we use for digestive issues, which is Ami Visnaga, actually can be quite good for irritable bowel syndrome. You would just do the inhalation process and the inhalation actually can help reduce the tension in the gut and the imbalance in the gut that causes that. So let's go through and treat it and just see how these things feel. So again, Ami Visnaga, geranium, rose geranium, peppermint, or the IBS blend. Geranium and rose geranium work quite well for this. And so, we don't really think of geranium as being a go-to for some of these things, but it works quite well. So your awareness is on the front solar plexus, below the ribs, on the upper abdomen,
Do you remember the optional pepper purchase?
Once I was during them. Oh, let me look. Yeah, rose drain. You're still on the front solar plexus. You're taking nice, long, slow, deep breaths. And now the back solar. What are you using? That's what it smelled like. I was like, yeah. Your back solar, which is your mid back area, you're taking nice, long, slow, deep breaths. The other thing that It doesn't. When we do this for the website, we should break up the lectures and do like hyperlinks to the YouTube. So, yeah. I didn't think about it like that until you said that. You're still on your back solar plexus. Nice, long, slow, deep breaths. Then your awareness is on your navel. Nice, long, slow, deep breaths. Your awareness is on your navel. Now, when we're treating the potentials for IBS, really focus more on the navel and navel minor. You're still on the navel. Nice, long, slow, deep breaths. Now, an inch and a half below the navel. Nice, long, slow, deep breaths. Bottom of the tailbone, the basic chakra. Yeah. Let the basic go and practice abdominal awareness. You could look for it anywhere, but I would say for this I would go lower. Like I'd look at like just above and just below the navel. Like if you go just like all the way across, like explore that area. You can explore anywhere in your gut, but for IBS, I would look a little lower. Explore first, like give it a minute, and then we'll start inhaling. But like really kind of explore that lower abdominal area. If it's up high for you, go up high. But okay, so wherever you feel something, if you don't feel something, then just do like a band, uh, just above and just below the navel, all the way across. Oh, it's more of a respiratory oil than it's interesting that it works for that. And then just pause for a moment. Just pause. How'd that feel on you? Let's do another round of that one. Your front solar plexus, the area below your ribs. Nice, long, slow, deep breaths. Your back solar plexus, the mid back area, you're taking nice, long, slow, deep breaths. Awareness is on the navel. You're taking nice, long, slow, deep breaths. Your awareness is on the navel minor, an inch and a half below the navel. The bottom of the tailbone. The bottom of the tailbone. Nice, long, slow, deep breaths. Now let's go to abdominal awareness. Feel it anywhere in your abdomen, but if you're not sure, go down by your navel, just above, just below, all the way across, side to side. Where are you putting your awareness? Yeah. And does it, can you feel something happening? And be still. So let's share experiences, ask questions. You can unmute yourself, type in, like, how did that treat you? You know, it doesn't mean that you have IBS, but, you know, it's just like a kind of tension or bloating in the gut. But if you start having issues where you get cramps from time to time, or you vacillate between a little constipation, a little diarrhea, uh, yeah, it could be this irritable bowel issue.
Like, woo.
Yeah. If you think about it, you're taking tension out of the gut. And so,
Lots of yawns.
yeah,
There were some different people and like yawning.
yeah. I think Samantha used Amy Visnaga, which, it's mostly a respiratory oil, but it does have an impact on irritable bowel. And geranium also very good for irritable bowel. Peppermint just by itself very good for irritable bowel. And then the blend IBS is a old formula. It was actually made by a French physician who was also a medical aromatherapist. And so back many years ago, so I just followed his recipe. Yeah.
And then we did have some questions in chat coming
Sure,
through.
yeah.
What is in the IBS blend?
Let's look. It is there's a very particular kind of basil called methyl chavrocol. I don't talk about it very much. It's a different chemotype of basil. So it's this funky kind of basil, and then peppermint, ginger, cardamom, and lemon verbena.
If we were going to order geranium, is there any advantage to getting rose geranium?
For this regular geranium, Egyptian geranium, rose geranium, all work about the same. So I would say, if you like it, it smells a little bit more like roses. If you like it, it works. The Egyptian is a little more heady. But other than that, they're all pretty solid.
Could a tight or inflamed psoas or iliacus affect IBS?
I would say somewhat. The psoas being a hip flexor, that's a skeletal muscle. Let's actually see. Do you mind handing me that book right there? I mean, I guess I could get it.
Which one?
The red one that's laying on top right there. Oh, I'm gonna need the other one. I'm sorry. I need that other one. Yeah, I'll switch you. Let's look it up real quick and see. Because I can talk off the top of my head, but give me just a second. I know this makes for boring streaming, but I'm curious. So it's not associated directly with irritable bowel, but if the psoas is irritated or contracted, has an issue, not so much the iliacus, but the psoas itself, which is the hip flexors that come along the lumbar and then drop down into the pelvis and then eventually attach to the femur, the thigh bone. That when they're contracted, they can put pressure on the intestines. And it doesn't say that, or it doesn't necessarily mean that it would be a big factor, but it's anatomically, it does put some tension and pressure on the intestines. Then if you look at the neurological impact, like if the psoas or the diaphragm's tight, there's usually some sort of dysfunction in the autonomic nervous system. Like there's usually sympathetic nervous system dominant, poor vagal tone. And so I don't know that it would be a cause of irritable bowel, but I would say it could be an aggravating factor. Same with the diaphragm, probably an aggravating factor. And so, just treating the psoas might reduce some of the symptoms if it's an issue, but it wouldn't necessarily irritate irritable bowel. The things like irritable bowel, you have a vacillation between constipation and diarrhea. There's abdominal muscles like in and around the navel. There's a bunch of trigger points in and around the navel that when they're contracted, they'll cause diarrhea. And so I would say, if anything, some of the lower stomach muscles potentially could be a bit of an issue, especially if there's bigger bouts of diarrhea. People who have irritable bowel, a lot of times will talk about like tension and bloating, especially down in the lower area, and they get this little band of like inflammation where that area, like kind of below the navel or right around the navel, will get kind of inflamed and kind of puff out a little bit. And so you're kind of in the area, so you never know. It could be a contributing factor, but I would say if it is anatomically, there's pressure, but it's probably more a neurological thing that could be putting something in place. But I would treat more the abdominal muscles than anything. Yeah.
IBS versus Crohn's disease.
What's the question?
Will they go ahead and type in or unmute themselves? Okay, there you go.
Okay, I'm asking about the difference between the two, IBS and Crohn's disease.
Well, here we're just treating a functional issue, like something like Crohn's disease is a much more, this isn't necessarily a disease, this is just a functional problem. And so IBS would fall under several things that could be.
Okay.
So like, I don't, like it seems like you have a specific question. What's the question? Where are you going with that?
I have a relative who's had Crohn's disease since or what they now realized was Crohn's disease since he was 10, and he was worked very hard to get it under control. And I was just wondering how the IBS protocols vary or differ or affect Crohn's disease. And it may be later in the book. I just haven't had a chance to read the book yet. The booklet.
No, I don't think I put Crohn's disease in there.
Okay.
But here we're talking about a vacillation back and forth between constipation and diarrhea, like spasms, things that's a little bit more like colitis, or Crohn's disease is a really serious chronic inflammatory condition. And so that's why I was like, I wasn't sure where you're going with it. IBS can be part of different conditions, but one, you're dealing with a chronic inflammatory condition in Crohn's, and IBS, you're dealing with like tension, spasms, bloating, and the vacillation between constipation and diarrhea. So
basically, for metaphor, kind of difference between having a cold and having pneumonia. They kind of have some of the same symptoms, but one's way more serious than the other.
yeah, I mean, I think why I got a little confused, I don't know that I would put them in the same ballpark. Like, yeah,
Oh, okay.
they're digestive issues, but with Crohn's, you're dealing with inflammation, like super chronic inflammation, and the effects that the inflammation has on the system. And IBS, when it gets really bad, can be very debilitating, but you're dealing more with like spasms, and there might be some inflammation there, but they're kind of different animals. Like it's with the inflammation, there could be IBS present. That could happen in a lot of different conditions. There can be IBS present, but it's not necessarily the cause or the condition. It's just a byproduct of the spasm and the vacillation between the constipation and the diarrhea.
Okay, thank you.
Yeah, you're still on.
Is IBS oil better than the single oils?
I I think geranium works pretty good for IBS. I think the IBS blend works really well, but I wouldn't underestimate the effect of geranium on this particular issue. And the inhalation of Amivisnaga. So I don't know that it would be an either or for me. Like if I was really dealing with serious IBS, I would probably be doing the blend. I'd be doing Amivisnaga. I would be doing some form of geranium as well.
Someone shared I kept having left leg spasms run from my foot up the leg.
I don't know what would be causing that. I mean, you are reducing tension in the gut and spasms in the gut. What oil were you using? I'm just curious.
Maybe I'll go to the next question
Sure.
while they type in what oil they were using. Question: in a person with IBS-D, allergies, seasonal food and chemical sensitivities, high acidity, gallbladder issues, candida, would it better to start with the leaky gut issues? In other words, where would the focus be in the starting the healing?
I would bounce around. You could start with the leaky gut. I would definitely do IBS. I would treat some work with the gallbladder. Peppermint is probably your best bet for treating gallbladder issues. A little bit taken internally, but if at first it's a little too much, even doing inhalation, but eventually it will need to be internal. And candida, there's a whole section on candida that I would say address the candida as well. I would say that, when there are several things going on, you kind of bounce around a little bit and start treating all the different pieces. And, some are going to resolve quicker than others, but just to focus on one particular area. I mean, I think it would be helpful, but those conditions usually overlap a little bit. And I would say keep keep treating the different aspects. It doesn't have to be all at the same time. 1 week you do this, next week you do that, and next week you treat a little candida, and just start trying to get things to improve a little bit so that you can really fine tune what needs to be treated and addressed at a more significant level. It's most likely it's probably going to be candida, but I would still address things for a little bit and start bouncing around and seeing how the body responds to treatment.
They said the reason for asking is the IBS-D is triggered when exposed to allergens.
Yeah, but the body is in that state for a reason, and so I would say that when the body is in a more sympathetic dominant state, the tendency is for the body to be more reactive and more allergic, like histamine levels. Because even when you utilize something like quercetin, yes, it has an antihistamine effect and diminish allergies, but part of what it's doing is it's making your body also all those things, but it's also making it less sympathetic nervous system dominant. And so still I go back to start treating things and looking at it from the point of view of a symptom. You always end up kind of wrestling with the symptom, but here you just start playing with the different functional components and keep reducing it. And as those things improve, or maybe they don't, and you need to still address some other issue. But I would say probably the primary thing is the candida. Yeah. But as they improve, it should lower histamine levels.
Thank you so much.
Yeah.
The person with they used rose geranium.
Yeah. Boy, I'm not sure. I was wondering if it was Omnibus Naga, just because it does have an antispasmodic effect on skeletal muscle, but I'm not sure why. I mean, the geranium definitely reduces spasms and tension in the gut. Maybe something shifting around in the gut sometimes will affect the spine and the spinal nerves. And so could be some of that, but I honestly, I'm not sure.
They said it was uncontrollable.
Yeah, that's kind of weird. Yeah, I get that a little bit in my red leg sometimes, and it's odd. Yeah, especially, none of these are, I don't know. You are taking tension out of the gut, and in theory, that should lighten up the spinal, tension on the spinal nerves. But what happens sometimes if something's really compressed, spinal nerve wise, the nerve will kind of go to sleep or diminish in function. And as the pressure starts to lighten, it shifts to more like moderate amount of pressure. And when there's a moderate amount of pressure, things get excited. And so I would say if that was happening, I would kind of not even so much for the sake of the gut, but for the sake of the spinal nerves. I might do that for a little bit just to see what would play out and see if that doesn't make the back feel better. Again, I go get therapy, trigger point therapy, but the guy is also an Ayurvedic practitioner. And, first thing he always says, like, how's your back doing? And, I might have activity where I've been picking things up or bending over a bunch and everything, and I won't be in pain, but I go, it's a little tight. And he's like, it's something you ate. It's something in your gut. It's something, like, he's always like, it's your gut. And I was like, no, nothing's really been different. I think it was the stuff I was picking up. And he'll kind of look at me like, well, I don't know if I believe that. I think it's your gut. And then, he'll work on me and he goes, well, the gut seems to be the same. So maybe it's something else. But in his mind, like all back issues are the gut. You know, I'm not saying that that's true. I'm just saying, you know, the tension in the smooth muscle of the gut can impact spinal nerves. And so, or like pressure on the spine. So
Is there a tincture for IBS?
the blend, I'd say peppermint would be the thing that we have. I haven't made an IBS blend. Right now, I would say peppermint, but you know, maybe that's on my to-do list of make something for IBS. It'll take me a little bit because it takes a while to like have the herbs ready, and I might be able to mix things that I already have. So
And how much quercetin is appropriate?
it depends. I would say at least 2 tablets twice a day. In more severe cases, I'd go up to 3 capsules twice a day. In really severe asthmatic conditions, I would say even 3 capsules 3 times a day. But usually two capsules twice a day is usually pretty good.
And go ahead, Ralph.
Hey.
Hey, Greg, how well does internal peppermint work for this?
Yeah, I would almost say that's your best bet. Like
Okay.
still do the breathing pattern, but do a little bit of peppermint internal. Yeah.
Okay, good.
Yeah.
Another oil question. If I'm going to get some geranium, is there any advantage to getting rose geranium over straight geranium?
No, for this, I would say about the same. You know, honestly, if the rose geranium has maybe a little bit more activation on the heart, and so
Mhm.
I would say that's good. The Egyptian geranium's pretty nice. It's a little heady, you know, and so that could be nice. The thing that's nice about geranium, and you don't really think about it like that, is also energetically, it's very cleansing. It's very, very cleansing. And so uh like the last like I don't know what's it been like a month. I've been using it in my spray bottle when I do healings, and I
Mhm.
like it. It's nice. Like it's I tend to like things like more woody and things like that, and but it's been very effective in doing that. And so, you know, the thing that's nice about geranium too is it's a very inexpensive oil. You can, you know, you can use a bunch of it.
Okay. So the Egyptian geranium falls into the more towards the heady,
Yeah,
the woody
definitely
end.
it's more heady. Rose geranium is more heart for the heart.
Okay. All
Yeah.
right. Thanks.
Yeah, you're so welcome.
Earlier, it was mentioned that digestive enzymes should be taken between meals. Just to be clear, an hour after the meal?
So that's not for digestive issues. That was for treating injuries to the body. And so just any time in between meals, you know.
Is there a negative effect of taking enzymes?
A negative effect, like a side effect or
I'm guessing so. Yeah, translation.
not that I'm aware of. Yeah.
Will we be able to get off of them easily once we restore the gut?
Yeah.
This is wild. I feel like I've been doped.
Right.
Lunch break is going to be a nap.
Yeah. It's a thing that like we don't realize how much tension we have in the gut until it's gone. And then you're like, ugh, you know, sometimes even sleep related issues are just tension in the gut. And so, like you said, you feel like you've been doped. Taking the tension out of the gut, it makes the body relax, makes the mind relax, but it allows you to go into deeper states of relaxation. And so, yeah, your gut might have been running a marathon you didn't even know about. So, okay, how about we'll break for lunch and we'll come back at 2:05, so an hour and a half from now. Hey, everybody, let's come on back. Some of the stuff that we do this weekend is just going to be us chatting about things, but I like to mix in the practice. And so with that, do we give them the updated?
Oh, it'll give me.
So we're going to send out another booklet. There was still a few items that weren't in the first one we gave you. So she's going to take care of that for a minute.
And I'll post it in the chat here for you guys. And then the Sunday link will also have this updated workbook.
So I'm going to jump back to number 2 and under the functional area, which is just supporting digestion. And this is a real basic thing, but sometimes the basics are a good foundation to leap into treating other things. And so this just helps to support proper digestion. So this is enzymes, stomach acid, bile, in general. We have more specific things that has to do with each piece of that. But these essential oils are very good for that. But also the idea of utilizing apple cider vinegar, bitter herbs and digestive enzymes. And so, Samantha makes that ginger tonic, the AG ginger tonic that's on the site. And you can use your own apple cider vinegar. I just had a client that utilized some apple cider vinegar, and they were a little freaked out because their urine was real dark. But part of what happened was it impacted the liver and flushed out a bunch of stagnant, like bile and other things that are in the liver, and got flushed out in the kidneys, and it made the urine dark for a few hours. But they were concerned that it was blood in the urine, but it was actually just a flush that happened in the liver. And so again, a lot of times we're not super aware that there's an issue here, but going through and treating it helps to ensure that problems don't arise from just basic functions. And so, it could be from stress, it could be from all kinds of things. It can be from fatigue, inflammation, low vagal tone. Any of these things would cause an issue. So again, we have anise, clove, fennel, ginger, rosemary, tarragon, and ANS support. The kit for purchase, you have both ANS support and ginger, actually. So you could choose which one you want to use. So you've got your oil, and here we're going to do this breathing pattern, and there's like 2 pieces of this. One, we're going to go through and treat the aspects of the digestive tract, and then we're going to utilize the 3 brain. And the reason being that this helps to diminish sympathetic nerve dominance in the digestive tract. Basically, the effects of fight, flight on the digestive tract. Okay, so whichever oil you're using, Begin inhaling. Your awareness is on the throat. You're taking nice, long, slow, deep breaths. Your awareness is on your throat. You're taking nice, long, slow, deep breaths. Move your awareness to the front heart. Your awareness is on the front solar plexus, the area below your ribs on your upper abdomen. Your front solar plexus, you're taking nice, long, slow, deep breaths. Your back solar plexus, the back solar plexus, the mid back area. Your navel, your awareness is on the navel. Your awareness is on the navel. Nice, long, slow, deep breaths. The bottom of your tailbone. Your awareness is on the bottom of your tailbone. And then just pause for a moment. Just pause, check in with the abdomen, the whole abdomen. Where do you feel something in the abdomen? Your awareness is on that spot. Start taking nice, long, slow, deep breaths. You're inhaling on the abdominal area. And then just pause and let that go for a moment. Let's make a bitters, like a tincture of bitters. Doesn't that sound good? Do you? Let's still stick with the abdominal area. Again, you're feeling where you feel something in the abdominal area. Your awareness is there. You're taking nice, long, slow, deep breaths. And then pause and let go. I'm just going to pause for a moment. Begin inhaling. Your awareness is on the sex chakra, where the sex organs are. Nice, long, slow, deep breaths. Your awareness is on the Mingmen, the backside of the navel. Nice, long, slow, deep breaths. The front solar, the area below your ribs on your upper abdomen. Back heart. Your awareness is on the back heart, the area between the shoulder blades. And then the brain, your awareness is on the brain. Your awareness is on the brain. In the crown, the top of the head. And just pause and be still. We're going to do another cycle, but I always find this to be kind of relaxing and fortifying both at the same time. You can use the same oil, or if you want to rotate it and try a different one, you can do that. Which one are you? You're inhaling, your awareness is on your throat. Awareness is on your throat. You're taking nice, long, slow, deep breaths. I think we're losing Samantha. I know. And then the front heart. Yeah. So, like, maybe let's just stop for a second. So, the thing with the throat is you're treating the esophagus, the upper part of that's still part of the digestive tract up here. And so, the reason why I started with that was we hold a lot of tension in the esophagus, but we have no idea. Like you don't really have an idea until you're like, oh, I feel a spasm in my chest, or you might have like swallowing issues, or anything like that. But there can be an incredibly big amount of tension in the esophagus, and it goes completely unnoticed. And so the treating the throat and then the front heart, a lot of times if you feel the manifestation, it might even be like you feel this little weird kind of spasmy tension in the chest, and different than like a cardiovascular issue, or like you're having a breathing issue where you feel pressure on the sternum. It's just this, like, you can almost feel the esophagus and the spasm that it is. And you'll notice that, like, sometimes when you're eating, or taking like capsules or pills or something, tablets or capsules, and you'll swallow them and it feels like they don't go down very well, or they're going down and they're feeling stuck or something like that. It's because there's tension in your esophagus. And so that tension will eventually manifest down into the gut. And so here I just kind of followed it down the throat. And, we could have even done the throat minor a little bit, but the throat should be sufficient. Hitting the throat, then the front heart. And, the heart center is not anything to do with digestion, but it does still, have an impact on the esophagus, just because the esophagus passes through that area. And then you get down into the solar plexus, which is usually where you would start to treat something like that. And you're hitting it at the bottom end of it. So those first three, the throat, the front heart, and then the front solar plexus, you're relaxing the esophagus quite a bit. And it's knocking you out, right? And if somebody walked up to you and go, how's the tension in your esophagus? You'd go, I don't have an issue there. You might not have a medical condition, you might not have a symptom, but it doesn't mean that that area is functioning like it should. It's probably got tension. There's probably some spasms in there, or times where it spasms. There could be all kinds of issues there that you don't really recognize. And so we did the throat. So now let's go ahead and go to the front heart. This protocol right here is a great, just general tune-up for the digestive system. Kind of hits all the marks. Nice, long, slow, deep breaths with your awareness on the front part. Your awareness is on the front solar plexus, the area below your ribs, your upper abdomen. You're taking nice, long, slow, deep breaths. Back solar plexus. The mid back area. Move your awareness to the navel. Your awareness is on the navel. Nice, long, slow, deep breaths. And the bottom of the tailbone, the basic chakra. And then check in with your abdominal area, the whole abdomen. Where do you feel something? Your awareness is there. You're taking nice, long, slow, deep breaths. And then pause and let go. Begin inhaling. Your awareness is on the sex chakra. Nice, long, slow, deep breaths. Your awareness is on the Mingmen, the backside of your navel. Nice, long, slow, deep breaths. Awareness is on the front solar, that area below your ribs on your upper abdomen. You're taking nice, long, slow, deep breaths. Back heart, that area between your shoulder blades. And then the brain. Your awareness is on the brain. And then the crown, the top of your head. Just be still. Just be still. Keep your eyes closed. Let that incubate for a moment. So how do you feel? You want to share experiences, ask questions? Gonna mute yourself, type in, but this is a good, like if you're looking for just a good general treatment for the digestive tract, just to do a little tune up or just to see how things are going, this is a great one to do. But anyway.
Go ahead, Denise.
Hey.
Oh, it was really, really nice. I could feel it up in my jaws for a while and the sides of my neck. But I just would switch over to tarragon, or I
Mhm.
even brought in lemon verbena for a few minutes. And anise, I could almost drink that stuff.
Yeah, it's delicious, huh? Like licorice in a bottle.
Yes, I might have to order more of that one.
Yeah.
Oh, it's really, really helpful. Thank you
Yeah.
so much.
You're so welcome.
I can feel
So
more.
you are feeling it in your jaws? It
Uh-huh.
makes me wonder if you don't have a little bit of an esophagus issue. Like if we wanted to do a deep dive, maybe we'll do that. A deep dive on the esophagus itself, its throat minor, in your jaws. And so sometimes when you have tension in your jaws, because the mouth is still part of the digestive tract, it can be actually a digestive issue.
Interesting.
Mm-hmm.
Throat minor, and jaws.
Yeah,
Right?
you know what? We'll do questions and shares, and then we'll do a little variation of this where we do a little bit of a deeper dive. I almost put it in here, and I was like, oh, throat and front heart kind of get it enough. But we could do a little bit of a deep dive on that. So,
Thank
I
you.
mean, that's what this weekend's for, is like explorations and experiments, and you know what I mean? So let's do it.
Thank you.
You're so welcome.
Question came in and some shares as well. Does the whole pattern diminish fight flight in the digestive tract, or just the three brain?
It's the combination of the oils and the pattern. I would say it's probably a little bit more of the three brain, but the first part of the pattern does help, especially if you're using, one of the oils that we have listed here. And so, and it's not so much that it takes you, I mean, it does kind of take you out of fight flight, but it helps to tone the sympathetic nerves and make you less sympathetic nerve dominant. So it's like it's more about like a potential rather than just pulling you out of fight flight. I know that sounds weird, not like I'm splitting hairs, but there are things to do to like try to pull you out of fight flight. And then there's times where it's like, I gotta stop going into fight flight all the time. It's like it's the second one. Like you gotta, when you're trying to not get so into that fight flight, which could be a byproduct of stress or fatigue or just wear and tear on the body. Your body's super agitated. Um, so anyway.
Very relaxing. Used both oils in the kit.
Oh, nice. Did you have a favorite? ANS or ginger? I think ginger was the other one, right?
Mm-hmm.
Yeah.
Let you know what they post.
Okay.
Question. When you say put your awareness on the center, do we put awareness from being within the physical body on the skin part or above 1 inch off of the skin or below the skin or all of them?
You just put your awareness on the body, on the surface. So like just go to the skin or the part of the body there. If you start to feel things in your body, you can kind of go into that too. But, you know, at least in the initial part, just put your awareness on the skin.
My experience was I felt like my chakras went through an upgrade. Immense gratitude for the healing and facilitation.
Yeah. Yeah. I mean, it's nice to just regulate the digestive tract. Like, I would agree.
The person who did the both, ANS, and
Yeah.
they use it frequently.
Yeah.
During the process, I keep burping loudly. I don't know if it's the pattern or the clove oil. And then they switched to ANS and said, nope, that didn't change anything.
Yeah.
So
Sometimes it's just, you know, yeah. So like when you're releasing something, that kind of happens, or if there's a little bit of like tension in some of those areas, you might have it. Sometimes it might be even a way to release like kinds of, you know, we do this thing where we sometimes, especially if there's a lot of sympathetic nervous system dominance in the digestive tract, where we gulp air, like we will kind of breathe through our mouth more than our nose, and then when we eat food, we'll you know be chewing, but we'll gulp air as we're doing it. And so sometimes how the body tries to regulate that is later it will try to burp it out, you know. Or if you're like me, you know, like I like bubble water and things like that. And so the bubble water will make me burp a little bit.
they said it felt like releasing something.
Yeah. Yeah, very well could be.
Would this protocol help during a very painful stalled food swallowing?
Stalled food. I'm not sure. Like, so you're having a hard time getting food down, or
And you can type in.
Sometimes I will eat things that I haven't been able to figure out a pattern at all, but I'll eat something and it'll get down to about to the bottom of my throat, maybe a little bit more, and kind of into my almost into my chest, and it's so painful. And
yeah,
I
so
can't rinse it out. You can't add water because that just makes it
yeah,
worse.
right.
And so it just feels like it's stalled. And eventually
Yeah,
it ripples itself down, but it's
right.
definitely yikes.
So that is like tension or spasms in the
Yeah.
esophagus. So we're going to do a little process here. I would say your best bet would be ANS support, anise, or fennel. Tarragon might work too. I mean, all of these would work, but those would probably be the ones that shine. Um, and then the other thing is lobelia tincture. Like if you have lobelia tincture, take it for a while, like daily for a while, because it relaxes body tissue, it relaxes the diaphragm, and it will relax the esophagus. You know, and we had that antispasmodic tincture that went out. That would probably do it as well.
Oh,
But
good.
the anise, the fennel, um, ANS
And
support, you know, and there was a blend that I made like quite a while ago, aerophagy, you know, and it just means gulping air. And so that could be used for it as well. But it's like basically anise, fennel, I think it's got caraway, and you know, it's got a bunch of the digestive herbs and things in it, you know, oils. And so we're going to go through, let's we'll take whatever questions.
Is
And
that
then,
something, 1 second though, is that something that I could do during the attack or just afterwards?
no, you could do it during. Like I
Like,
for that, I would just start inhaling like anise or something. Yeah.
okay, great, thank you. Because
Yeah. Yeah.
sometimes it's hard. I mean, I don't panic, and I knew it'll pass, but it's like, make it go away, make it go away. So I
Yeah.
will.
And if you notice that, like, if you slow down your breathing, like a lot of times it will release faster. So even if you just kind of inhale, exhale, but you slow it down, you take a little bit of a gap in between, and you just keep trying to, relax, it will relax it and allow it to go down. It's just like trying to relax through a cramp if you're stretching or something. It's the same idea. It's just in a different, weird, awkward spot.
True
It's
it.
like you get a cramp in your calf, like, okay, I do these things, but you get a cramp up here and it's like, ugh, what do I do? Especially like you said, you got food or a pill or something going down. And um, yeah.
And I was also wondering, and I was, trying to form a pattern. Would it have anything to do with food that is a day or two old? So it's got like some kind of
No,
secondary.
it probably has more to do with that your body has become a little bit more sympathetic nervous system dominant.
Okay.
And so it might have been not so much the food you were eating, it could have been foods prior, could be tension in the gut, could be stress levels, could be things like that. It's not so much about what you're eating in the moment that's causing it. It's that your body was already there, and then whatever you took, um, it just wouldn't go down or is going down very slowly. And so it's more about what happened before than it is in the moment.
Okay, because I was afraid it also might be a process of, gobbling like a puppy, the eating too
Yes,
much too
but still
fast and not chewing.
gobbling like that is still like sympathetic nervous system. Like
Okay, thank you.
that is a little bit more dominant. Rest and repair mode is eating a little slower. The digestive system is able to relax and digest the food. And so even the gobbling is usually like you're stressed. Whatever that is, whatever reason. It might be emotional, it could be your body's just agitated. It doesn't always have to have like emotional or mental reason. It can be just that the body's agitated. Yeah.
Thank you.
Yeah, you're so welcome.
My gut is really talking. A lot of different sounds and feelings coming to the surface.
Yeah. Good for you. That's actually a very good sign.
Totally relaxing, mainly from the chest down.
Yeah. Yeah.
I think we're ready for a little deep
So
dive, right?
let's do a little experiment with the esophagus. And so again, whatever oils, but if you have ANS support, anise, fennel, I mean any of them would work, but those would be probably my first three choices. So dig around. Now, keep in mind, this isn't necessarily for your jaws. This is for your esophagus, right? So we're going to start with the throat. Begin inhaling. Your awareness is on your throat. Nice, long, slow, deep breaths. Now go down to your throat minor, which is the bottom of the throat. Now go to your jaws where they hinge in front of the ear. So like right there. Your awareness is on your jaws. You're taking nice, long, slow, deep breath. Thank you. Okay, now go to your back throat, the middle of the back of your neck. And then go to your front heart, the center of your chest. And then just pause for a moment. Let's do that again. Your throat. Nice, long, slow, deep breaths with your awareness on the throat. Your awareness is on the secondary throat, the bottom of the throat, that little notch between the collarbones. Now move to the jaws where they hinge in front of the ears. You're still on the jaws. You're taking nice, long, slow, deep breaths. And just feeling when you, yeah. Hmm. And how about your jaws? Because I saw you stretching your jaws. Yeah. I think I need to put this in the booklet, maybe like make a section just for esophagus spasms or something. Yeah, yeah. You know what I should have put in here too, even though it's more like a circulatory thing, is like hemorrhoids and things like that. Yeah. That's true. So you're on the back throat, the middle of the back of your neck. And then your heart, the center of your chest. And then just pause. And since it's an experiment, we'll do one more cycle of it. It's short, we'll cycle through it again. That's feeling good for you though. Samantha said, like, it's like relaxing your jaws, but not completely, but it's making even her neck like relax a bit more. Interesting. We could tie that into treating neck issues. Yeah. Yeah. So just pause and be still for a moment. Okay, so we'll do one more cycle. Your awareness is on the throat. Nice, long, slow, deep breaths with your awareness on the throat. You're at the bottom of the throat minor. You're taking nice, long, slow, deep breaths. Your jaws, where they hinge in front of the ear. And then the back throat, the middle of the back of your neck. Awareness is on the front heart. And then just let go. And then we it was about 3:35. Like not exact, but you don't also have to edit it. We can also do it again. Okay, does anybody want to share experiences or ask questions about that? I mean, that was a bit of an experiment. We'll add that to the booklet, but go ahead and share if you'd like. Unmute, type in.
Yeah, go ahead, Teresa.
Hey,
Hi. That was interesting. The first go round, I fell asleep, and the second one, like the joints in my arm hurt.
yeah, I
And I
don't
thought,
know why that. I don't know why that would be. Yeah,
okay.
I could make something up. Like I don't know.
Yeah, okay. So you don't
Yeah.
see anything?
No. Like they hurt in the joints, or they just the whole arm hurts.
Um, yeah, just the whole like forearm, actually.
Hmm. And have you been having any sort of shoulder issue or anything like that?
No, just a pretty stressful week.
Yeah. Um, I mean, it could be a byproduct of, we were kind of whispering back and forth, probably not too quietly, about how this could even be added to maybe doing like neck work, like trying to
Uh-huh.
unwind the neck. And, there's different things that we do, but it's not going to take all the tension out of the neck. But, you look at the issues with the esophagus, with the trachea, they're going to, the trachea would be like what you'd call the windpipe, for respiration,
Mhm.
but they're going to contribute to some tension in the neck. And with that, you have the muscles in the neck, especially on the sides, are associated with the brachial plexus, which is a bundle of nerves that goes down and then would feed into the arms. And
Okay.
so, my only guess is like for some reason, I would think that it would have more of a releasing effect.
Uh-huh.
And again, I kind of go back to sometimes like when you bring the nerves back online, it's like when you're sitting on your foot and it kind of goes to sleep,
Yep.
and then it starts to come back to, it kind of hurts for a minute, and then it's like,
Yep.
and then it gets better. Is
Yeah.
that sometimes with the nerves in different areas of the body, they were, a little bit asleep, something was compressing them enough to where, the sensory nerves really weren't being felt. And so you open that up and then you might feel something for a little bit, but it should pass kind of quickly. But
Okay.
it's probably a bit of an unwinding of the neck would be my guess. But I mean,
Okay.
yeah, I mean, when I look at you, I don't see anything really big jumping out. So that would still further kind of reinforce that it's probably something like that.
Okay. So then just keep doing it.
Because it's like those kinds of things, they're subtle. Like, they're not a big thing. It's like if there's a bone, if it's impingement, bone or cartilage is pressing on the nerves, and even though you unwound the esophagus, that probably wouldn't change that very much. But an entrapment is just like soft tissue along the way, kind of going on the nerves. And then when it relaxes, it takes the pressure off, and then it's like your foot waking up.
Got
And
it.
so entrapments are much more subtle. They're they're not always in the same place because it might not just be one spot. It could be like a series of like tension or compression that's along a whole pathway. And, it might start from here and work its way down, but you might not feel it down into the forearm. But the issue is like the neck and shoulder and, all the way down. And so,
Yeah.
it's probably something like that.
Okay. All right. Super.
Yeah, like
Thank
you
you.
said, you had a super stressful week, and so, I mean, not surprising. The body's, even though your mind and emotions might have good handle on it, your body's like, I'm freaking out, like, you know what I mean? Like,
Yeah.
just have those freak out moments, and I had one the other day, like a couple of weeks ago. Remember, I wasn't even doing anything. I was just bent over for a long period of time, and my body went into a weird stress response. And I mean, I had to sit down and like calm the body down for a little bit. And I was like, really? I'm at the age now, like bending over for 20 minutes, like doing, I was doing things with my hands, but I was bent over for a long period of time and it put my body in a stress response. And I was like,
Hmm.
getting old's kind of weird.
Got it. Yeah. Well, thank you.
Yeah, you're so welcome.
Go ahead, Denise.
Hey.
It's definitely, that's where I need to work, is all in that area. I could feel even the top of the back of my tongue, at times.
Oh yeah, sure,
all
yeah,
the way
yeah.
down into, especially that right sterno, that behind my ear, halfway down, and then into my shoulder. So it's just that area is gonna, I think.
I'm going to say that, one that I would have not put in this mix, but like as I sit there and watched you guys kind of do things, is for this little protocol, not necessarily for the one that's in the booklet, but like just trying to calm down the esophagus. I'm going to say vetiver could be in the mix. Like vetiver could totally be in the mix.
That's great. And well, I have the the antispasmodic tincture. I have that, but I don't have fennel. So just work with the vetiver and the
Yeah,
antispasmodic.
vetiver, or do you have anise at all?
Oh, I do. Yes, and
Yeah,
that's
use anise. Yeah, sure. Yeah.
Thank you. Thank you so much for working with this, because it definitely has given me some homework.
Oh, good. Yeah, and it's a simple, quick, easy one too.
Yes.
After the break, we're going to come back and talk about cortisol, and that would also be vetiver. So, and would also contribute to what we're talking about right here. So, yeah.
Thank you.
You're so welcome. And is Babette?
Let me just let me see what I can make happen for you.
Yes, sir.
Hey, did that help your
Yes, it did. As a matter of fact, I just typed in the idea that it was a great relief knowing that the body and the mind, that there was a protocol that could prevent and or ease the pain, and also that gobbling was not the cause, and that the jaws are moving smoothly and quietly with a lot less
Good.
clicking.
Yeah, I would say gobbling is probably more a symptom of it rather than the cause of it. You know what I mean? Like when you feel yourself like doing that, you know, it's easy to fall into the habit, like if you're always pressed for time and you got to eat fast and da 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 da. But that's one thing. But the other thing is that just sometimes if the body is in more of that sympathetic nervous system dominance, then the tendency is that the gobbling becomes more of an issue. And so yeah, I would try different ways of winding it down. And like you said, it's already feeling better. I would just keep treating it for a little bit, and you'll notice that it doesn't. I mean, some people have it all the time, but it will just happen and then it won't happen for a while. And then it will happen and then it won't happen for a while. And so I would say just from time to time, I would do that. Like I take the anise tincture sometimes just to like keep the swallowing and the esophagus and the gulping of air, and it's a little bit of a also for the heart and for some respiratory function, and it's just it does a bunch of things, not massively, but it's like just good like toning. And so I'll just do that tincture for like a week or two, and then I forget about it. But one of the things that I don't get it too often, but every once in a while I'll get it to where like when I'm taking some capsules or something, I can feel it like having a hard time going down, or maybe eating at the time. I find the other contributing factor, I don't know about for you, but for me is fatigue. Like if I'm tired and I've been tired for a while, like I'm tired for a few days and I'm kind of pushing and doing stuff, I tend to start having those kinds of symptoms. And then the other one, you may or may not relate to this, is when other people are pissed at me.
Yeah, had a
Yeah.
good bit of that lately. Thank you.
Yeah. It might be more of that than you think.
The hurricane's been in town.
Yeah. Oh, there
Right.
you go. Yeah. So it's probably a little bit of that.
Mm-hmm.
Because there's times where I don't even know. I don't know that people are mad at me or something, but all of a sudden I'll go, oh, I feel a little weird in the chest or whatever. And then a day or two later I hear, through the grapevine, oh yeah, they were totally pissed at you.
Well,
Oh,
I'm
two and two
deeply
together makes sense.
I'm really grateful that she loves me enough to be mad at me, but then again, it's still a hurricane, and when she gets to level 5, it's like, woo, there's no place
Yeah.
to duck and cover. Just
So it could be a
give it
little
up.
bit of that.
Yeah. Okay, good. Thank you.
So if you know that, like if you know, like, hey, what'd you call her? Hurricanes in town.
Hurricane,
Yeah.
Hurricane H.
So take some anise internally, do a little inhalation, do lobelia tincture a little bit, and it should keep everything in check while that stress is there.
Yeah, she's encouraging a major life change that I promised I would in 2 years, but she wants me to move now. And that dog's not going to hunt, and I'm not quite sure how to. Anyway, sorry, we're talking private stuff. I will contact you for later.
Okay.
Yes, thank you.
Wait,
So
there might have been more. Sorry, I'm like a little too spacey on myself here. Let me make sure I got all the shares.
you're all like, I'm good. It's funny. Like there's times when we're doing the protocol and Samantha's like, she's doing it, she's fine. You see her relaxing, and then there's times where she's like, this was one of those
Yeah,
times where you're like, oh.
Well, and I feel like it's ridiculous. Like I'm good, I have energy, and then I'm like, and now I'm passed out again.
Yeah. It was funny to watch.
Okay, that really is.
Okay. So how about we'll take a break? It's 25, so 20 till the hour. So I'll see you in about 15 minutes. And when we come back, we'll talk about cortisol. Hey, everybody. So I didn't write a bunch about this. I guess I'll go through and I'll drop some more into this. But let's go to number 7, chronic cortisol elevation. And cortisol is a byproduct of the adrenal glands. And, when we've been stressed out for long periods of time, or we've been in states where there's sympathetic nervous system, domination, there's usually elevated cortisol levels. So cortisol is related to regulating your metabolism. So if it's elevated, your metabolism is off. It's tied to your stress response. It's tied to your immune response when it comes to inflammation. So your ability to reduce inflammation is also tied to cortisol levels. blood pressure regulation. If cortisol is elevated, then part of the issue is the balance between salt and water in your body gets impacted. This can constrict blood vessels and can cause the blood pressure issues. It will have memory and cognitive function effects, and it will also throw off your sleep with your circadian rhythms being thrown off. The tendency is with high cortisol levels, there's weight gain, fatigue, mood changes, weakened immune system, high blood pressure, skin problems, digestive issues, and sleep disturbances. So we want to go through and treat this. Essential oil wise, vetiver works really super well. There's not really a pattern that works. The best thing to do is to inhale it, like maybe 20 to 30 times, but also kind of feel it in your body, which we'll go through and do. One of the better herbs to use for helping to regulate the cortisol levels is ashwagandha. I mean, this is an area where ashwagandha just shines. So it will improve sleep, it'll improve mental function. It's not quite like a sedative. A lot of times it kind of gives you more energy, or at least for me, it increases energy levels. But part of what it does is helps to regulate the adrenals and helps to lower the cortisol in the body. And so I would say if this is an issue for you, and a lot of people have this issue, it's just to what degree. I would do the combo. I would do the ashwagandha and I would do the vetiver. Now, I kind of listed here also that if there's a gut lining issue or if cortisol's been elevated for long periods of time, there's going to be an inflammation issue. And so I would also look at treating the stomach lining with bacopa. So that was one of the very first things we did at the beginning of the day. But that's just if it's just been there for a long time, your body's fighting off a lot of inflammation. So, okay, so your best bet is vetiver. If you don't have that, I think that's also in the kit for purchase. Yeah, it's in the kit for purchase. If you don't have that, let's just try to find you something relaxing like spikenard or valerian, marjoram maybe, but by far vetiver would be the thing to go to. Sage could be another one, but all of those are B choices. Vetiver is by far the A choice. And what we're going to have you do is just start taking nice, long, slow, deep breaths. There's not even really a pattern that we're going to do. Just take nice, long, slow, deep breaths. Keep taking nice, long, slow, deep breaths. You're still taking nice, long, slow, deep breaths. And let's just be still for a moment. Let's go ahead and have you take long, slow, deep breaths with the vetiver again. Nice, long, slow, deep breath. And then just pause and be still. Now, as you're pausing and being still, one of the things that helps in the reduction of cortisol is practicing awareness on the body, right? So, first, just be aware of your body. You're not inhaling right now, you're just being aware of your body. Where do you feel some tension, some agitation? It's not necessarily going to be your bad back or your bad knee or bad shoulder. I mean, it might be, but don't just automatically go there. Pay attention to where you feel something in your body. Hmm. We're going to do this a few times, so if you have 3 or 4 spots, we can hit all of them. So whatever jumps out at you, if it's one of your spots, fine, that's good, but don't just go there automatically. And whatever is the one that feels like it's the most, put your awareness on it. And before we're inhaling, just observe it for a moment. You're not trying to relax it. You're not trying to make it go away. You're just observing it. In doing this helps to balance out the nervous system. And this also helps to increase rest and repair. Okay, keep your awareness on that spot and start inhaling the vetiver. And then pause. Notice how you feel. Your body, your emotions, your thoughts. How does that make you? Okay, again, without inhaling, feel it in your body. Think of it like this. When the adrenals are hyperreactive or overactivated, however you want to say it. Hyperreactive is a better way of saying it, but however we want to say it. The tendency is to be more stuck in the intellectual component, which is also associated with fight, flight, and repetition, right? And just maintenance, like your guard is up, right? Just by doing the practice of observation, that automatically shifts you into rest and repair mode. It shifts you into a mode where you're able to start digesting, you're resting, which means sleep and things like this are going to start to be more regulated. Blood pressure has the potential for regulating. Your stress response has a tendency to regulate. Vetiver has the ability to calm these things down. For one, it's very calming, it's very soothing. Like two, you're doing a practice where you're observing the body and then you're inhaling it. And if you look at it on a superficial level from the point of view of what the oil is doing, vetiver is calming and soothing, but it's also kind of grounding, right? It helps to calm the body to the point where you feel grounded, like you feel in your body. You're in your feet, you're aware of the footprints you leave as you walk, as you walk across the floor or across the meadow or whatever, you're in your feet, kind of, so to speak. But part of how it does that, and in India, this is referred to as the oil of tranquility. And the reason why is, when we look at vagal tone, vagal tone is again going into rest and repair and all these kinds of things. We look at it from the point of view of like, let's just bring the body into better vagal tone, like more rest and repair. The body needs to have more healing, more rest, more repairing itself. So that's an idea, but after we kind of get that idea down, then we start going, okay, what are all the areas that impact vagal tone, and what areas are good and what areas need more work? And so vetiver is very good for the vagal tone, the influence of the limbic system on vagal tone. And so emotional learning, your stress response, some memory functions, fear responses, like how you emotionally react and adapt. There's all these components of the limbic system that are tied to like stress and fear and all these things. And so if you can improve vagal tone there, what happens is your body goes, ugh, like this is very nice. Like, your body loves it, right? And so we're shooting to have that because even if we calm down the vagal tone in the gut, and even though we calm down the vagal tone and in the respiratory tract and maybe a little bit in the cardiac muscle, and if the adrenals are still hyperreactive, we might calm them down somewhat, but the adrenals are going to kick back up again because they've never fully been regulated. And part of this is why we don't always look at things as a symptom oriented. It's easier just to say this does this does that, this does this, do this, and then you kind of do it and you go, well, I feel a little bit better, but something's still wrong, right? And it's because there's these like functional issues that are much deeper to address, and they're not as easy to see as just looking at different symptoms. They overlap quite a bit. And so part of the glands are still tied to your vagal tone. And we're actually going to do in June a big thing where we blow by blow look at all the different aspects of vagal tone. It's a free class that we'll do in mid June. I think mid or late June, somewhere in there. And let's look at all the little things, like how much does the vocal cords play a role? How much does the inner ear play a role? How much do some of the muscles in my body play a role? How much does the spine play a role? How much does the digestive tract? How much does the liver? How much does the sinuses? Like, if we can hit all of these, it makes the body repair itself much, much easier. And it makes us calmer. It makes us feel a greater sense of well-being. It helps us to think clearer. And if you look at what spiritual practices try to do, part of us realizing ourselves, there's different levels of realization, or I should say there's different levels of self, right? And the first part is this thing between the mind and the body, right? And if you can calm down all the vagal tone, that is literally like the mystical version of realization. Like as far as the lower self, you begin to like, oh, this is what my body's saying, this is what my mind's saying, this is how they interact, this is how they're connected. And that becomes a form of realization, is just calming down certain parts of the nervous system. It's literally that mechanical. If you just can calm down these parts of the nervous system, which takes work, but if you calm them down, you actually become more and more realized as far as the body and mind are concerned. You're having the first level of realization. And then from there it snowballs. Like there's other things to do later. But if we can't get that one, the rest of them really can't happen. And even if you're not wanting to be realized, we still want to be happy. We still want to be healthy. We still want to have good relationships. We still want to not freak out at work. We still want to, be able to get along in the world when the world is going crazy, that we don't like lose it and lose our minds. So even if it's just that's the motivating factor. I got difficult people in my family. I have difficult job that I'm doing. I work in human resources, and like whatever it is, it helps you respond to situations rather than to react. And the byproduct of overreactions in the body is cortisol. It's a big piece of it. It's tied to the adrenals. It's also tied to the pituitary and the hypothalamus. And so if you look at all the things that could potentially go wrong, your metabolism, your sleep, your stress response, um, blood pressure, blood sugar regulation, like all these things, what do? Everybody's got some issue somewhere in there. And if you've had a difficult life or a stressful life, or the body's in a little bit of a tailspin, cortisol is a very good place to look. Like it's a very good place to kind of start pulling things together and going, let's calm this down, and then we can calm all these other areas down. And this is just kind of like a taste of like how to address cortisol, but still it's a good one. Like, a lot of times with the use of ashwagandha and vetiver kind of consistently, you can lower and begin to regulate the cortisol levels. Doing the practice where you sit and you practice observation, you go, okay, my shoulder hurts. Okay, I'm going to observe it for a while. All of a sudden pain levels go down. Basically what started to happen is you were in pain, your body started to release adrenaline because something feels wrong, and then that starts to tense up muscles. It starts to increase the pain levels. It starts to spiral downward. But if you can go, okay, I can sit and I can observe my shoulder, and I'm observing it, I'm sitting with it, I'm being non-reactive. It just seems like, oh, I'm kind of trying to relax or rest, but literally what you're doing is you're increasing vagal tone in the body, you're calming the nervous system, and you're going to the adrenals. Okay, yeah, my shoulder's in pain, but behave. Like, you adrenals, behave. You stop acting like that. Like, you stop getting triggered and just going nuts. Like, you're literally teaching the adrenals to calm down. You're not shutting them down, you're not sedating them, because if you're getting chased by a cheetah out at the mall, you got to be able to run. Like, why there's a cheetah, who knows? But still, like, there's times where you need adrenaline, right? But we don't need adrenaline because somebody said something snarky. You know what I mean? Like, it's just like, okay, yeah, you're a jerk, but I don't have to have this adrenal response because you're rude or somebody's obnoxious, or whatever might be going on. And so this idea of even just practicing observation, you're shifting out of rest and repair. Or, I mean, you're shifting into rest and repair. You're shifting out of action activity, which is also fight and flight. And so this is literally the two sides of your brain. Like, you have the intellectual part that is repetitive and is associated with maintenance. And then you have the other part of the brain that is more spontaneous and is associated with healing or repairing, right? And so, that's the explanation in the body. And we call it intellect a lot, but it happens in our mind, it happens in our body, it happens out in the world. Even if you were to break it down and say, okay, what is that same mechanisms, but out in the world? That repetition and maintenance, spontaneity and healing, right? So out in the world, intellect would be nature. Like, if you look at nature, nature's always in conflict, right? Bigger animals are eating little animals. Plants are struggling for water and nutrients, and you get some ivy or bamboo in some area and it strangles out all the other plants, and they're fighting for food sources, and everything's always a push and pull, push and pull, push and pull, push and pull, right? Even that part of your nervous system is push and pull, push and pull, push and pull, right? And so the intellect is literally nature, right? Intuition is grace. It's literally grace. It's the ability to go beyond the duality, to be able to go beyond the conflict of something, and to have something shift, have something move, have something heal. And if you look at it from the point of view of the Bible, in the old days, it was an eye for an eye. And then at some point, it became the potential was, forgiveness and compassion and love your neighbor. Eye for an eye is intellect. Forgive your neighbor, compassion is intuition. I mean, it's literally that. And we have our foot in both of these worlds. And so, it seems like, oh, I'm dealing with cortisol, I'm dealing with stress. But if you can get a handle on it in the body, if you can even get a little bit of an understanding, it will begin to manifest out in the world, in your emotions, in your mind. It will manifest in ways that are beyond our comprehension. And so it seems like a very simple thing to be doing. And in a way, it is. But it is a thing that is a representation of something that's much bigger and much greater. We're never going to understand it intellectually. But if we keep playing with it in these areas, all of a sudden we develop this skill set outside of our body where we can start playing with, okay, when I'm in intellect, this is how I got to do it. When I'm in intuition, this is how I got to do it. And I have the ability to step out of intellect or repetition into a healing place. The first journey is being able to do it in your body, right? The first journey. So this idea of playing with cortisol levels, it's simple, but if you really go deep in it, it's quite profound. Like even the vagal tone, all the vagal tone stuff, very, very profound. It impacts your emotions and your mind way more than you realize. Way, 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 way more than you realize. It impacts your sense of well-being. It impacts your relationships way more than you realize. And so, this act of like, okay, I'm going to feel it in my body, and then I'm going to inhale vetiver. It's just one way. It's not the only way. It's just a way. But you notice that your body starts calming down, and you start having less responses to things, and your body doesn't go into a stress mode just at the drop of a hat. And sometimes we have years or decades that we're unwinding. For me, I would say decades. I'm unwinding decades of it. And there's times where I do pretty good. And then there's times where my body's like, ugh, I remember that time that was really bad. Like, it's still shaking off those things in the past. And the more that you do some of these like simple practices, it takes you deeper and deeper into something that you want, you just don't know it by name. You don't know like, oh, this is gonna make me feel so good in all these areas and relationships and the way I think and even the way that I react to the world and all these things. But if you can calm these things down in your body, you'll start to notice that how you interact with the world also changes. Boy, that was a tangent. So, like with that, how about we go back and we do the observation and the vetiver again, and then we'll kind of chat about it a little bit. So, again, just feel it in your body. And wherever your awareness is at, take some long, slow, deep breaths with vetiver. Nice, long, slow, deep breaths. And then just pause for a moment. Keep your eyes closed and just be still. You're observing your body. Where do you feel it in the body? And begin inhaling with your awareness on that area. And then just pause and be still. Okay, let's go ahead and share experiences. And how did that make you feel, by the way? Did you do some of your areas? Yeah, how do those areas feel? So, like, one of the things that I would say is, we want to feel it in the body when we do this, but at the same time, if say you have a bad shoulder, a bad hip, bad knee, something like that, you know, a lot of times we'll just go to the bad hip or to the bad knee. And it's important to spend time observing the body, even if you still end up going to those areas. But areas of pain or where the area is compromised is going to naturally generate more cortisol because your body goes into a little bit of fight flight because of the pain or the degeneration in the area. So doing this practice even on the spots is good. But I would say still do the observation, because the observation is also part of how you're switching out of the intellect and the repetitiveness of the mind. And so by going through and going, okay, I'm going to observe the body. Where else do I feel it? And if you go, okay, I feel it in my chest, but I still have a bad knee. But I'm going to do the chest first, and then eventually I'll get to the knee. But if something is painful, it's not necessarily for if I do this, the pain's going to go away. It's more of if I do this, the byproduct of the pain on the rest of my body is going to diminish. So it's not immediate, it's more of a long-term thing to approach and address. But if you do this over a period of time, it's very stabilizing to the body. It is very, very stabilizing to the body. So again, I would use vetiver and ashwagandha together. But anyway, I think we even put it in the kit for purchase, right? The ashwagandha. I'm pretty sure we did.
Yeah, I think those were the two we did. The
Yeah, we
Bacopa
did
and
ginger,
the
bacopa, and
Yeah.
yeah. So anyway,
And then go ahead, Sonia, then Teresa.
hey Sonia.
What about adrenal insufficiency, the cortical insufficiency?
Yeah, with insufficiency, the vetiver will regulate it a little bit, but the insufficiency, I'm trying to recall what I do for that.
Don't you have to address the cause, which is
A lot of times,
elevation?
I actually, if I remember right, I'd have to go back to my notes, but I go to and treat the adrenals with adrenal stimulants. So rosemary, thyme, camphor, sage, pine, things of that nature, because the stimulants are stimulating proper adrenal function, which means it either will regulate it if it's too high, but if it's too low or too fatigued, then it helps to regulate that and bring it back to like normal function, you know. So I mean there are conditions where you have to go deeper than just that, but for the average person, that's usually enough. But I mean that can be an issue, but most times it's usually more the opposite, where it's too high. But I would start with adrenal stimulants.
And those are, you said rosemary, pine, and
Rosemary, pine, camphor, sage, and like red or white thyme. Any of the thymes will do it, but red or white thyme is probably a little bit stronger. Benchmark thyme as well, but you could get by with red or white. Benchmark thyme's a little bit more expensive and a bit more rare. So, but those will help to, if the adrenals are too high, it will still make them regulate, but if it's too low, it will make it regulate and normalize as well. Yeah.
oh, okay, you said rosemary, camphor, pine, and
Sage,
sage.
and then red or white thyme. Yeah. And it, for the pine, you can use Sylvester pine, but I kind of like black pine and white pine for the adrenal stimulants. Um, but any pine would work.
And just inhalation.
So there are adrenal
Yeah, so
stimulants.
you would do inhalation, but I would put it on the body. Red or white thyme, I don't know that I'd do it neat, but everything else you could kind of do neat, on the wrists or like on the feet or something. The red or white thyme, I'd just put in a little bit of ointment and, rub it somewhere on the body, like on the abdomen or low back. But lots of inhalation, lots and lots of inhalation. Yeah.
Okay.
Yeah. Try that and see how that works.
And then go ahead, Teresa.
Hey.
Oh, sorry, I muted you. Sorry. Let me press this again for you.
Okay. I just looked up in your body mapping because my forearms really, really hurt, and it looks like it's released.
Hmm. Interesting.
Yeah, like they just got even more intense with vetiver.
Did it really?
Yeah.
That's almost the opposite of what I would expect.
Yeah, me too. And
Yeah.
I feel like on the verge of like a cry. And I'm just
You
curious.
had a super rough week. Like, I mean, I get it. Like, yeah, I get it. Like, because, we don't have to go into details, but like, it's the immediate thing, but it's also, like you said, like the patterns of things in the past. And like, sometimes there's like the worlds collide a little bit. You know what I mean?
Yeah.
Yeah.
Do you see anything coming out of my forehead?
Usually that is either something breaking down like a thought form or a thought pattern.
Okay.
I'd say the big thing is the solar plexus and like uh like whenever the solar plexus is getting sassy, I like to also work the back heart because the back heart will help it to release and will transmute a lot of what's coming up in that. The thing that's interesting is like with the solar plexus or when we're releasing something deep, it can come out of the spine, but also, it's not emotional the way we think of emotion, but it can also come out of the basic and we'll feel it in the solar plexus, but it's the basic as well. And your basic is looking not super funky, but it's like looks like something's like
Really?
coming out a little bit.
Okay.
Yeah. Yeah.
So any recommendations?
I kind of like ginger lily for you in this. Um, Astral projection would be nice. Ginger lily. Um, St. John's wort. St. John's wort could be nice.
Okay.
Even not vetiver, spikenard.
Okay.
Just because it's very cleansing to the field. It will help things come out. But just even as we're talking about the oils to use, I can feel the tension in your body going down.
Okay.
Yeah.
I
So I
just got
would say any of those is probably a good call.
okay. I do have ginger lily. So
Yeah.
just
I
inhalation.
think ginger lily probably would be my first choice.
Okay.
Inhale, if it like just inhale for a while, put a little bit on your wrist and on your heart, but also if you want to work a pattern at some point, you don't have to do it right off the bat, but like if you go, okay, I'm stabilizing, I'm feeling a little better, do the Mingmen back heart crown.
Okay.
Yeah.
Mingman back heart crown. Okay. All right. Thank you.
You so welcome. Keep us posted.
Question, would one ever take vetiver internally, say to help lower blood pressure?
Yeah, I mean, it might lower blood pressure a little bit. I think it actually is quite good for the digestive tract. I also have people use it for if there's like starting to be like an autoimmune kind of issue, might not be full blown, but it's you know, starting to dance its way into the field. But it does calm down some of the tension in the digestive tract. So I would say, yeah. And on top of that, it's also just calming and soothing. There's been times where I've taken it just to like calm the nerves and just calm the body down and, get a little bit deeper sleep and things like that. So I would say, yeah.
But it is okay internally?
Oh, yeah. 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 Yeah.
Will camphor on feet for cleansing also adrenals affect the
Yeah.
adrenal?
Yeah. It would. Yeah. Yeah.
Thank you. Um, That's it for the process questions. I had a question come in on class related, but didn't want to wait that.
Yeah, we could do that.
So non-class related.
Mhm.
Regarding next week's angels class, I am only familiar with archangels. Curious if there is or was another class that incorporates gods or angels from other traditions.
Um, yeah, it's not in that class as at this point. You know, at some point in the past, we've done things with different deities in a couple of classes. You know, not lots, but some. Um, you know, I have a bunch of notes there, but you know, I also kind of try to do things that people are interested in. And so if there's a bunch of interest, I'm glad to do it. But I don't just throw things out there. Like what tradition of like the deities or gods or the angels from other traditions. You know, here with the angels that we're drawing upon, it's usually, you know, Kabbalistic, Christian, Islamic, you know, things of that nature. A lot of times they're the same things that people would address in other traditions, but they might not even refer to them as angels. And so, yeah. But what are you thinking? What thing are you wanting to look at?
And you do not have to unmute yourself. You can just type in if you'd like. If you're okay with it while they type in, I
Hmm?
did, oh, here, Hindu tradition.
Oh, Hindu. Yeah, we've done some of the deities. I mean, like, you know, Shiva, Vishnu, Brahman, Ganesha, Saraswati. I mean, there's probably a dozen that we've done. I don't think they've all made them into a class, but we've definitely made blends and things for that. If there's particular deities that you would like to address, we could do that. You know, send us an email. I don't know if you're wanting blends or if you're just wanting information, but information might take a little bit longer because I have to go through my notes and then just have the time to do that. And so if it's blends, I could probably turn that around a little faster.
And this is just me saying this. In the past, we've had people ask about working like the deity blends, and you had given like a pattern
Mhm.
in the newsletter too. Would that be a simplified?
Yeah, that would be a simplified way of doing that. You know, you can work deities kind of like how we do in with the theurgy with the angels. You know, because the thing with the angels is you're practicing a kind of practice called theurgy, and so you know, putting forth that, and the thing with angels, and I would say the same for deities, is a lot of times we think of it as this being, like if we think of Archangel Michael as this being that does, you know, whatever he does. Um, it's really more of a position than it is like a being. And we invoke the different angelic names. The names act as like a portal to a deeper kind of energy that we would have a hard time accessing ourselves. And so the work with the angels is tied to accessing more of like divine intelligence or divine love, but like through that portal. And so the act of theurgy is to make ourselves conductive. At first, you're making yourself conductive to the angel, but really what you're making yourself conductive to is divine intelligence and divine love. And so there's a similar practice like that with deities. Sometimes the practice is slightly different, um, but not massively. Like there's some very, very strong similarities. And so in the booklet that we gave a booklet that had a whole bunch of angels in it, and I think it was about 112 pages. And I'm adding a bunch of information for the class next weekend that's not necessarily more angels, but it just is more of like the groundwork of why you work with angels and some of the mechanics of that practice, and even defining angel versus archangel, and why you would invoke those or work with them. And so I would say all of it's universal, the same thing. Like I would say Archangel Michael is in the Hindu tradition. It's just they don't call him Michael. I had it down somewhere. I can't remember who the being was, but anyway, um, yeah. I mean, I can do a little bit, but it would just depend on time and everything. Yeah.
Someone's asking, can we use the same oil kit for angels?
Yeah, no, it's the same kit. This would be a review class for a lot of you. There's going to be more information in the book, but we're still using the same oil kit that we did, whenever we did that class, like what is it, 6 weeks ago or whatever. Yeah, it's the same kit. Yeah, we're going to practice more. We're going to work some different angels, and I'm going to give you some more information. Yeah.
Someone said, another great class. I had pain in my right shoulder this morning. Now it's all gone. Had PRP done for a tear in my rotator cuff on Monday. Just so you guys know, last week was a 1-day class. Stay tuned. We are going to be here tomorrow doing even more good stuff.
Right.
So.
Yeah. Tomorrow we're going to continue this. Tomorrow we're going to do a deep dive on the liver, by the way. And we'll look at different conditions and things. I mean, there's a whole section of the booklet we haven't even talked about.
Can you talk more about the upcoming class, Heart and Thousand Petaled Lotus, like more description on what to expect in the class, or who is it for?
Yeah, that is we'll put out information probably on Wednesday on that. We'll I think it's already been posted in the newsletter, right? Or on the schedule.
Just the
Just that,
basics.
yeah.
Just the basic. I don't think I have any description other than
Right.
the basic stuff. Represent a link.
Yeah, let me form my thoughts a little bit more. I mean, we're starting to go into deeper aspects of planetary energies, but it's not how people think of like astrology and stuff. It is like inner practices as it has to do with the planets. And the development of the heart is tied to working certain planetary energies in very particular ways, and not just like, oh, I'm working the moon or I'm working the sun, but there's like aspects and things that you work to develop when working the planetary energies in the inner way. It is a way to refine intellect. and it impacts on like higher cognitive functions. Like you could say there's mechanics to being like a genius. And part of that would be working the different planetary energies. And so we're going to target one planet in that class, but it's not about working planets like you've ever done in anything. I guarantee you that. And we're going to work the aspects. And so the first aspect is the moon. We're going to work the moon. But the inner practice of the moon. I'll lay out like the bullet points for why we would do that, and we'll have it out to you guys next week. Yeah. Yeah. I just gotta, there's so much information there that I have to kind of make it digestible for you guys. And so if I start talking right now, it would just sound a little bit all over the place. And so I'll put my thoughts together this week. I mean, it was already on the schedule to do anyway. So
Thank you. And then we have some more shares and questions still coming in. Any suggestion for Hashimoto disease?
usually I start off with clove. Clove is the very first thing that I do for that. And then after your treatment with clove for a little while, we see how the condition is reacting or not reacting, and then we make adjustments. But 2 or 3 drops internally daily, especially if you can do it twice a day, that would even be better. But clove should be very helpful for that.
Yes, I definitely needed this class. Thank
Oh,
you.
good. Yeah.
Just making sure I didn't miss your guys' questions. I think that's it for today.
Oh, good.
And so join us tomorrow, guys. We'll start at 10 a.m. Central. And we'll keep working this digestion.
Yeah, like I said, we're going to go deeper on the liver and some of the I don't know, conditions and things. So if you have questions, write them down so we can address your questions tomorrow.
That's what I was
Like,
just gonna say.
a lot of back and forth with what you guys want to talk about as far as digestion is concerned.
Till then.